kindly seconder.
I'll second, Chair.
Thank you, Honorable Randall. Let me take
that setting of the MEC, she can be somewhere here. It can still be done.
Yeah, there's going to be a problem because I need to eye contact with the MEC, and if she's sitting on your side, I won't be able to see her.
Oh, okay.
Yes, so that's the biggest problem. And if she comes to sit here, she'll want to consult with the staff there, it's going to be a problem. Let me just say that have you received the notes, the questions, honourable members?
Yeah.
Okay, so this is what I suggest we do. We will, if you look at them, the first column is information it's your information so that you can follow what is being discussed or what questions you're going to be asking. Honorable Randall, are you finding it difficult to receive the information?
Chair, my laptop just crashed.
Oh,
So
okay.
I would need
Okay, sure.
somebody's, she's
Laptop,
going to help
okay.
me out. Thank you.
Okay. So what we suggest you do is, you'll see that there's a first column which is the information generally. That is there by the AG. We summarize some of it is as per the AG. But the next column is the question. Now, you can ask the question. You don't have to read it if you think you don't want to read it. You can ask it without reading. It's up to you. But please stick to the question. Obviously, we are still going to allow also for members to, if there's comments, additions, and all that. Even later, we're going to allow you if you've got other questions or other comments you want to make. So for now, it's going to be members who ask questions. Towards the end, we are going to allow our stakeholders to comment. We ask them to be very brief. Let them not make political statements, but let them just be brief and make their comments or even questions to the department, and then we'll take it from there. That's why we've asked that the CEOs and the members of the hospital boards must join online, so that if they want to ask questions, they can do so. Okay, one of the things we are going to do, honourable members, are going to be strict on time because the MEC has asked me, she has to attend a funeral. So we can't keep it beyond the time we've allocated. It's from now until 11 o'clock, as agreed. So if there are other questions we can't ask, we'll then send them we'll send a letter or something like that. Okay, so what we'll do is that we'll alternate, honourable members, before the next question. So for now, we'll ask that the first question, I will make the comment. Let me just indicate what will happen. So you'll see The first question is really about what they call subsequent event. I'll ask that question. So I'll ask the first question, which is A. And then from there, I'll ask that maybe Member Kanyan ask question B, Honorable Randall C, Honorable Kekane D, Honorable Mngube E. So you can read the question as it is, or you can ask it in whatever form you want to ask it. It's up to you. So are we okay with that, Honorable Member? So we'll take them like that. If another member comes, before, like if one person is asking a question, I'll say the next question will be asked by so-and-so, so that they are ready to ask the question. Okay, shall we have the MEC here in the department? Okay, thank you very much. Let's have them. Welcome, Member Atkinson. We got your apologies that you delayed. Sure thing. Member Atkinson? Member Atkinson? Member Atkinson? Members will alternate. I'll just indicate who's asking the next question after this, because Member Atkinson is here. Okay. Let me take this opportunity to welcome you, MEC. Thank you very much for availing yourself for this public hearing on the audit outcomes of the Gauteng Department of Health and the medical supply depot for the financial year that ended 31st of March this year. I'm aware of pressures of time that you have, so the fact that we're starting a bit late with you won't affect the end time, because I think you indicated that you've got pressures of time, and receive my condolences for the bereavement that is there. We want to indicate that the problem that the committee has, Honorable MEC, is the fact that there are a number of difficult things that confront these two bodies, which need you. And we are aware that you've just been appointed the MEC, but the good thing is that you are also from finance. So some of these things are things that you could be able to help us with. Thank you very much for that. I don't know if you've got some opening remarks you want to make.
Thanks, Chair. Morning, Chair, and morning to colleagues. Chair, I think I will not waste time, but want to apologize first for our last meeting that we were unable to honor it because of the Budget Council that Premier raised, and when we forwarded the apology, it was already late indeed, because we did confirm that I will be present, and our sincere apology. We were not undermining the committee. We know what is expected of us, and we know that MEC is the one that accounts to the committee, not the members, not the team health like led by the HOT. So our sincere apologies. I think we have some plans on the work that we've been doing through the acting CFO in terms of the controls, but working very closely with Department of Treasury and the audit teams that are in the department, including our medical depot and Auditor General. So I think we're building up that relationship, Chair. You will see when we present some of the work and the improvements that we're trying to do in terms of setting up controls in the department, because we all know that we had a problem of controls, and our report will talk to some of those critical things that you as SCOPA and finance teams want us to do in looking into our finances. So Chair, on that note, I will hand over to HOT to do the presentation that will talk even to some of the questions that you wanted us to raise. Thank you.
Yeah, MEC, we're going to run it a bit differently. We are not going to receive a presentation from you. We'll ask questions and expect response. Just for your information, so that you don't say we took you by surprise. We also have invited members of MPEX, chairpersons, some of them are in the room here. But also on the line, we've got the CEOs and members of hospital boards. So later on, some of them, if they want to comment, they'll do so. But then, yeah, so I thought I should raise that so that you don't say we ambushed you, we took you by surprise. Yeah, so, yeah. Now, we're going to be asking questions. We want to ask that you respond as, we know that when you say you, MEC, you can always delegate who can respond. We're not going to really separate MSD from the department because some of the findings are similar. So we'll take them all at once. And we want to ask that with your officials, they don't have to introduce themselves now. They'll introduce themselves as and when they speak. So anyone who's not going to speak today won't know them. So thank you very much. Now, let me see. The first want to acknowledge the fact that the Gauteng Department of Health has received an unqualified audit, although there are some matters of emphasis. And these are the things we want to discuss with you, because we think that these are the matters that if we don't prioritize or deal with them, we won't reach the clean audit that we want to achieve. Also, we think the similar with the medical supply depot. So we're going to focus only on those things because that's the priority we wanted to deal with. So for instance, let me start, and then after that, Honorable Kanyane will ask the next question. The first one is, when it relates to the issues of subsequent events, we realize that this is recurring in the department. But there's a specific matter that is under discussion now, which has to do with Charlotte Maxeke Hospital. There's a view that the problems as a result of the fire there are going to have a huge implication on the financials moving forward. Maybe can you give us an update of what, because this was by the 31st of March this year, so already what was the end of the year. What's progress made there? What implications, what anticipated implications, particularly on the assets and inventory, is this fire going to cause in the current financial year and moving forward? Over to you, MEC.
Thank you. HOT, I'm sure you will lead us in that question. Thanks.
Good morning, Chairperson, honorable members. My name is Nomonde Noluchungu. I'm head of department. The question in relation to Charlotte Maxeke, we did receive a report on the fire from SAPS, and that report is being now interrogated by the DID, who was the owner of the building at the time of the fire, in terms of implementation of the recommendations of the report of the hospital was handed over from DID to health that allowed us, or was an instrument to assist us take implementing agents out of DID to now an implementing partner who is the DBSA. And we have since signed an MOU with DBSA, working also closely with the National Department of Health. Project manager for the remedial and compliance work has been seconded to the department by the Department of Health. So there has been a lot of progress in terms of the infrastructure remedial work as well. In terms of the services themselves, we are now at a point where we can say the hospital is back to about 96% functional, where we have already the accident and emergency unit working fully, and some of the disciplines also fully functional. There has been a lot of decanting and moving some of the units that has had to happen during the remedial work that is being done there. Chair, I have to say though, that we still have challenges with security at the hospital. There's still a lot of theft happening, even as we intensified security services in the institution. It's a matter that we're acutely aware of, and we are attending to it. There were issues with the management of professional service providers, the so-called PSPs that were employed by the DID for the work. One of them was responsible for propping, keeping the burned area of the hospital up so to keep the integrity of the building. And we had challenges around the contract that they came into with DSD around that. That took us time to get resolved, and we have since resolved it. And some of the props have now even been removed. They're being removed as the building building work is improving. A lot of work, I have to say also, Chair, that has been done by donors, the Spire Foundation and the Gift of the Givers. They have assisted, especially with the accident and emergency unit. And Chair, I don't know if I should I'm answering the question, but that is the level of progress I can provide to the committee at this stage. But I'm happy to answer any specific questions in relation to what is happening at Charlotte right now. Thank you, Chair.
Thank you. Honorable members, are there any follow-up question? Honorable Kekane, then Honorable Kekane, then Honorable Mncube.
Yes, no, thank you very much, Chairperson, and good morning to everyone, MEC and the team. We appreciate the feedback or the progress report by the HOD in terms of the fire that took place at Charlotte Maxeke. I think from the presentation by the HOD, she mentioned that there is still a challenge with security. So I just want to understand what kind of challenge is that. Is it because the security that is there is not effective, or are there problems with procurement of security? And the reason why I'm saying this is because initially after the fire happened, we also asked the question, we queried the security levels at Charlotte Maxeke, and that was our concern. And I'm very concerned to hear that there is still a challenge with security when the fire could have happened because of lack of adequate security. Thank you very much.
Honorable Mncube, then Honorable Kanyani. Honorable Kanyani says it's covered.
Thank you, Honorable Chairperson. Let me take where my colleague left off and just emphasize on security. To say, is this security the new security that you have employed? Yeah, and then what are the reasons of the breach of contract? Because if you are employed to do security because there were challenges of ABCD, then it can't happen repeatedly as if they are not there. If it is an old security, what are the reasons that make the department continue with the old security where theft was an order of the day, and you are also saying it is still happening? Thank you. The last one is on oncology. When you say it's 95% working, functional, is oncology part of the 95%? Because that was the key thing, that was a problem for patients that need to be treated. Thank you.
Yeah, maybe lastly, because that's our concern, is the financial implications. Now that this is your responsibility, has it been properly budgeted for, or are you relying on insurance? Yeah, if you could give us the answer to that. Thank you very much. Over to MEC.
Edward, you want to do a follow-up or you want to delegate? Okay, continue.
Okay. Thank you, Chair, honorable members, MEC, colleagues. Regarding security, what we found was that, in fact, this is the so-called internal job. It's people who are employed by DED who know exactly what is happening there, and they're targeting copper wires and all of these things. They have all the time whilst they sit and work where there is work, the areas are open. Some of the removals take about 3-4 days to remove from the walls and things like that. And they have all of the time, maybe security think that these people are doing regular work whilst they are removing and stealing those things. But that has since been identified by the actual security company that is on site there, which is a new company since July, that appointed since July, if 6 months is new. But they have been found. We have evidence of people who have been driving with these stolen items. A case has been opened at the Hillbrow Hospital. Some of them were in jail for some time. I'm not sure, I don't have the details of what's happening with the capturing of those people right now, but I can find out where they are. But they have been found and they've been arrested, some of them. It's an internal job from people who have been working on site. Regarding the oncology services, we do still have a challenge in relation to oncology, especially radiation oncology. Members may remember that there is medical oncology, which is about medication and drips and so forth. And then there is this radiation oncology, which is your x-rays, treating cancer. There's a long waiting time for access to that treatment, not only because of what has happened in Charlotte, but because of also we have only 2 of these types of treatments in the province, one at Steve Biko and the other at Charlotte. But it's a matter that we are engaging intensively with the clinicians, the professionals. We are in the process now of procuring a portable treatment. It's called portable brachytherapy machines, where you don't need to close.
Honorable Kanyana is going to ask you 3 questions, but he's going to take them one by one. Honorable Kanyana.
No, thank you very much. Yes, indeed, there are 3 questions, and they are interrelated. It's about the plans that you have alluded to, MEC. One, could you indicate to the committee if the department has developed, adopted, and implemented a strategy to minimize litigation? It's about the litigation. And if so, then give us the progress, whether the strategy is effective.
Over to you, MEC.
Thank you, Chair, and thanks, Honorable Kanyan. Echokti, can I hand over to you?
Thank you, Chair, honorable members. With this one, through you, MEC and Chair, may I request Mr. Carol van Heerden, who's the head of legal in the department, to take the committee through the work that we're doing in the area of medical litigation. Just to say that it's an area that we really concerned about. Concerned about because it's not improving over the years. And we are finding also that as the service platform itself in terms of the quality of the service is not improving, it doesn't support adequately people who provide the service, especially in the area where we see these cases are coming from, obstetrics and gynecology, and subsequently then cerebral palsy. If the doctor cannot pronounce it, what more to other people? Cerebral palsy. Yeah, it's palsy, yeah. So, Chair, if I may I ask Mr. Van Heerden to take us through the work that we're doing in the area? Thank you.
Mr. Van Heerden,
Thank you, Chair. Chair,
you must introduce yourself first.
I'm so sorry. My name is Karel van Heerden. I'm Acting Chief Director for Legal Services at the Gauteng Department of Health. If I may proceed then to take the committee through the item under the heading Material Uncertainties Relating to Litigation.
I think what you should do, just answer what we're asking, because if you do other things, you'll confuse us.
Sure.
I think the direct question, is there a plan? How effective is the plan?
Thank you, Chair. Yes, we do have a plan in place. We were provided with a service provider by the National Department of Health, who assisted us primarily in the verification of our contingent liability register, so that we are able to account accurately for what is truly verified claims against the department. It was a long process that commenced during the 21-22 financial year, where we first had engagements with the Auditor General to agree as to what constitutes contingent liability. Because prior to that, we included items, for example, the...
That's exactly my problem, Mr. Because you are now generalizing. The question is litigations.
Yes.
What we know as a department is that, as the committee, is that this department has got litigation. It's been recurring. And it looks like you are unable to deal with it. And now I understand that these things happen in hospitals, and we might be wrong. And we know that last time when you were here, when it was still MEC Masuku, he indicated to us that some of the things you were doing, you were even going to an extent of getting patients, rather than paying them, you say, so that they can get services from somewhere else. You are now negotiating that it must be internal. You must, so those are things we want to find out. Litigation, do you have a plan? Is the plan working? Why is this increasing? And those are things that you want to, I think you are not dealing with record keeping. I'm not sure how it has to do with litigations. Thank you.
HOD, can you assist them on the specifics?
Yes, MEC, and Mr. Van Heerden will add to what I'll say. There is a pre-litigation mediation program whereby, Chair, we look at the severe adverse events from where most of these cases are coming from. And I indicated earlier that is in the area of obstetrics and gynae. In some instances, especially at the central hospitals where most of the cases come from, we have record managers and people with legal background who, after the cases that are a risk for litigation have been identified, the records are kept, are collected and managed, and there is mediation with affected families on redress on those issues that may further lead to litigation. It's a program that we've just started and is being rolled out to the rest of the hospitals. It's now at Central Hospital, mainly at the Chrizani Baragwanath Hospital, but it's being extended to other central hospitals. That's that element. And the next element, Chair, is when we get the cases, there is a company that has been working with us through the national contract. It's called the CAJV, and Mr. Van Heerden can share the full name of the company. They assist us when the cases come through, they assist with mediation, again, pre-going to court of the cases. They look at the records, also the integrity of the cases that come through. Is there fraud in the environment? Is there a real case? Is there a repeat of a submission by the lawyers? And they look at all of that, and they have saved the department quite a bit of money by that specific intervention. What they also do is to collect data of all of the cases to advise the department on where the hotspots are, so that those interventions are targeted in that way to assist the health platform environment to manage records, provide proper treatment, and reduce the risks. What also happens is mediation with the affected families so that the cases can be settled before they go to court. I think that the legal aspects of it, my colleague can assist, speak to that. There are those interventions. Of course, we can always do more, particularly in the area of improving the quality of service. MEC, if we can go back to Mr. Van Heerden.
Okay, Mr. Van Heerden?
Yes, Chair. Go ahead.
Thank you, Chair. Okay, then specifically with litigative intervention is we actively apply mediation as a means to save cost and time. It's very effective and very good results we've had in that regard. And then, we apply through our representative as a department's state attorney who appoint counsel for us. They always consistently argue what has become known now as the public health care defense. That is where we offer to render services in lieu of payment of cash, because in a medical legal claim, the most expensive component is future medical care. So wherever we can provide, whether it's therapy, whether it's prosthetic devices, whatever the need may be that we can offer as a government, we then offer that. It saves us an enormous amount of upfront cash payment. And it also prevents patients from coming back into the system after receiving a cash payout. That is a very effective means of addressing it. Then we, with the current acting CFO, we've had extensive engagement with our budget office, where we go back now to negotiate with plaintiff attorneys for payment terms. It's really an effective way of looking after our operating cash. As you know, we are somewhat cash strapped, so often if we don't do it, what the attorneys then do, they'll attach our bank account and the money's gone. So now, rather than allowing that to happen, we engage them proactively and we sit around a table and we negotiate payment terms with them. So, Chair, to capture that, those are the three things that we are currently actively pursuing, and we find them to be effective. And then, of course, we realize the importance of keeping proper record from the financial side, because, we're a team of lawyers, and I think for long our focus was on law, which is not necessarily the only component. It's just one of many. HOD explained what is done at clinical level, to prevent it, because that's where it arises, of course. So if, in our hypothesis, if there's no medical negligence, there's no claims. So clinical level is where our focus is now, to prevent these things from happening. But then if they happen, that's the three things that we've put in place to try and mitigate, and then also to keep proper accounting records, because it's a huge liability. It's a 20 billion liability, and it's something that requires skill to keep, compliant accounting records of. I think, Chair, in sum, that is what our efforts are focused on at the moment.
MEC, you'll realize that the responses, the concern that you have, the responses are about interventions after the effect. Our concern is, what do you have a plan to ensure that, we know you can't eradicate negligence. Well, you can because it's negligence, but you can't eradicate people litigation processes, but you can minimize that. I mean, is it the problem that the people in your hospitals are incompetent? What is the problem? Is it that, are you training them? Is the problem with people we are employing? Where is the problem? I think that's the main concern that we have as the committee. Rather than, yes, also are concerned about that. After that, what do you do? But for now, is there a plan maybe to retrain people, whatever, those are the, or is the lack of equipment? I don't know.
Chair, we do have a plan. We do have a plan, and we are working now in implementing the plan that we have. Even day before yesterday in our meeting, we were clear that our quality assurers in every hospital are the ones now that are going to direct this information to Carol's office, so that we have a team even at Carol. Now we're beefing up the team at Carol's office, so that even if National is giving us other that company that must assist us, already on our side, our systems are in place now of strengthening where there are loopholes, because we realized that even on our side, we were weak, we're not working very closely with the quality assurers who are already in the hospitals. And we're working up another strategy is to strengthen our legal team at the national office, which was not strong. Now Carol is going to have a team of people that are going to work directly with him, that are linked to each and every hospital, working with those quality assurers that are there at the hospital to pick up immediately these cases, and we deal with them. So I think, Chair, we do have a plan and we're implementing it. That's what I'm sure you wanted, and we will definitely give you even the type of problems that we're experiencing on the question, so that you are able to know what was it that we're getting, which hospital, and how many. We've detailed that report that will forward it to yourselves.
We'll appreciate that. I think it will help us a lot, yeah. Honorable Kanyana, do you still want to follow up with the two questions? Maybe we should ask both of them if you think you still want to, before we allow Honorable Randall to ask the next questions.
Yeah, you really covered me by those questions. That's precisely what you want as the committee.
Okay. Thank you very much. And maybe I should have, maybe I should just make a follow-up question on the systems now, the record keeping, because that's one of the key issues that the AG was raising. Record keeping in hospitals. This thing of patient safety incidents, the records are not there. You are still operating manually. The other question maybe I should ask MEC as you respond. Isn't it that you need your hospital board to be assisting in this regard? What is their role in all this? Are they not assisting in management at the hospital? It's over to you.
Thank you, Judy.
Thank you, Chair. Thank you, MEC, honorable members. Regarding record keeping, there is some work that has been done, Chair, since we signed up a contract with a company called Gijima about 1.5 years or so ago. It's a 5-year contract with different modules on a unique patient identifier, which should assist us know who has been through the system, but also assist with revenue management, assist us identify unregistered foreign people who access the service and their impact on the service. It assists us within the hospital to link up the blood services, the lab services, the medication, just to refine the system. It assists us with record keeping, assists us with picture archiving, where you have x-rays and others that can be read not only at this facility, but at a distant facility within a cluster. As I indicated, Chair, is 1.5 years through. Only some elements of the modules have been implemented to date. We had a meeting with Gijima about 2 weeks ago, for them to give us an update on the implementation of the project that is funded to the tune of about 300 million or so that we are on top of the quality and nature of the service through that contract. And we will be meeting with them. They did come and presented a highish kind of level presentation that didn't speak to the detail of responding to the questions sharp questions that you raised, Chair, on record keeping to assist us. And we have a meeting with them tomorrow, but during the course of the week, just to get a sense of the detail of what is happening at facility. MEC has been moving around through the hospitals. There are some instances where this is working. An example is Sebokeng Hospital, where records and queue management and so on and so forth is working. So my broad kind of answer to the question, Chair, there is an implementing agent that is assisting us with a program called HIS, Health Information System, and it's got all of those elements, including record keeping, and we're keeping close tab on the implementation of that contract. Chair, thank you.
Okay, Honorable Randall wants to ask follow-up
I
question.
think, Chair, before Randall
okay.
on.
Just press MEC so that we.
Soon, Chair, before they continue, colleagues, we will be going live, Chair, and we're going to invite you so that you can see how this system is working. Hence, we know that there are hospitals that were live already, but we have never announced that. People think that we have not done anything on our record system. And we've picked it up when I was visiting the hospitals, since we know that there are specific hospitals where we still want them to correct where we are down because of connectivity in specific areas. But all those things we have said to them, they must address them. But other hospitals, it's something that you'll be happy to see. Thank you, Chair.
Honorable Randall, follow-up question, and Honorable Kekane.
Yes, thank you so much, Chair, MEC, HOD. It seems like you're following kind of the road accident fund module in terms of you're not paying this excessive amounts, but to try and circumvent the cash-strapped situation that you find yourselves in by offering future services. And I think it's a positive, it's something positive for me to hear, Chair. But we previously also heard that you're going to look at the option of settlements out of court, rather than taking the matter to court and then try and battle it out. So can I just get an indication how successful this has been applied? And the second question, have you tested this model of yours, not paying cash, but to offer the claimant future services? How positive does it resound with the claimants, whether you think it's going to be working or not? Thank you, Chair.
Honorable Kekane.
Chair, I raised my hand earlier before my question because I just wanted to make a comment directed to the MEC. It's not a question, but it's my observation, especially at the hospital. I think there is lack of capacity of supervision, especially as relates to record keeping. Because if you go to a hospital, stores or filing area, you would find that it's chaotic. But because the staff who are assigned to do the proper record keeping are actually not doing what they're supposed to be doing. So my advice to the MEC would be to also maybe at the political level engage with the union leaders in the hospitals, because I think members of the union who are employees in the hospitals sometimes are dragging their feet and they are putting you into disrepute, Honorable Member.
MEC, as you respond to this, there's a question I asked about the hospital board.
Yes, Chair.
Sure, don't forget that.
Yes, Chair, we will not forget. Dr. Mokopane, if you can just be ready to answer on that one on the hospital boards. But Chair, I think we agree with you, Member Refilwe, that we had two meetings already with the unions just to sort out some of the things that we believe that they are not doing. those things as they should be. Like, we want to tighten our relationship with them because we don't want them to come after when there is a problem, so that we all move along with them in terms of correcting some of the problems that we've picked up in the hospitals. When we're visiting the hospitals, Chair, we were meeting with the hospital boards, and myself and Dr. Mukopane were he was part of the team because he's responsible for clinical services. And there are things that we picked up in some hospitals where hospital boards are not working very closely with us. Some, they see themselves as principals, not doing what is expected. And I think we're arranging, in December, isn't it? We're arranging a session with them now, just to educate them on what they should be doing. But Dr. Mukopane, if you can just elaborate on the issues on hospital boards that she raised, and then Stomonde, you will come with the comments from Member Randall and some from Member Dr. Mukopane. Dr. Mukopane.
Thank you, MEC, Chairperson, HOD. Yeah, on the issue of...
Introduce yourself properly.
Sorry, my name is Dr. Steve Mankupane. I'm from the Department of Health and Wellness, and I'm looking after hospital services. So on the matter of the hospital board, as the MEC just indicated, they have been recently appointed. We are basically on the phase of really inducing them. But over and above, if the previous boards had been participating in terms of the front care, so that then they'd walk about in the front area and check if the patients are attended and given service. In the agendas that then were discussed, in the part of the agendas, when the observation was made that there are more problems in the maternal areas, the issues that have been observed is number one, capacity, which as a department we are trying to improve. Most of the maternal claims will come from the fact that our systems are receiving a lot of more patients, so that some of the interventions are not performed at the times that were otherwise intended. For instance, the time to do a cesarean section. A plan will be made to do a Caesar there and there, but due to overflow of patients generally, then it's delayed and the outcomes then usually becomes a problem. So that we have identified as one of the problems in terms of theater capacities. We are
Maybe, Doctor, don't go into details as to whether, because I think the issue was really about the role of the hospital boards and what those, yeah, whether, so you are saying to us they've been able to identify some of the problems you're not dealing with, that you understand.
Thank you, Chairperson. Yeah, they've been able to identify, they've emphasized in their agendas that the training must be continuous as a recommendation from hospital boards. They are also involved in the keeping the quality receiving of patients, so that patients are then interacted with properly, and that reduces the frustration of the patients and therefore litigation. So those are some of the things. Previously, when they had a budget, they will also then intervene in areas of acute needs in terms of equipment, on consumables, but they are in principle involved in trying to make sure that the care of the patients is maximized. Thank you, Chairperson.
Response to question by Honorable Randall.
Ndima will take that one.
Thank you, MC. I think the question that was raised was on the road accident fund. I'll take only that part of the road accident fund.
I think the member was saying, it looks like you are taking the similar route that the accident fund is taking. She wasn't asking if anything about the road. She was making an example. So I think the essence of the question is, okay, you've got it right.
No, I think I got it. I think the question was around the options instead of waiting for attachment or court orders. What is it that you do? I think my answer will be direct. We have established a mediation process in matters of litigation. And then where we even have issues around anything that is alarming us on court matters, we immediately start that mediation.
Okay,
so that we
maybe
can
so that
go
you don't
forward.
waste time. I think the question was, she was asking about the impact, the effectiveness. I think that was the question, that is it,
Sorry?
yes, the settlement out of court, is it working? Are you seeing results? And
I think the HOD will take that one.
Thank you, thank you, Chair. We actually have realized some gains from the mediation process. Since we started, in the last financial year, in fact, to the tune of about 2 billion that we defrayed from some of the costs that would have gone to court, in the context of where the whole liability now is about 23 billion. And we managed to defray some of those costs. And the CAJV is really assisting us with the mediation process. We need to capacitate the unit to be able to do that on its own, because the contract with the CAJV expires at the end of December. And we're in the process now, and we ensured with them that they build capacity as they leave the contract. And MEC has given instruction to us that all cases have to go to mediation before they go to court. And we need that capacity to be able to do that. We're negotiating with the Office of the Premier to assist with that kind of capacity. We have had someone who has been in the department before who was actually quite good on the mediation kind of interventions, and the plan is to get them back to the department to assist us with that. So we are seeing some gains. It could be small gains. We need to ensure that we prevent that thing in the first place. But it's better than just going full scale, paying those settlements. Thank you, Chair.
okay, as Honorable Randall prepares to ask the question that she was going to ask, she's going to be followed by Honorable Kekane. I want to take this opportunity to welcome MEC Mamabulo. Thank you very much. I think that there's this legacy or a relationship that's there between SCOPA and MEC of Finance, and it's consistent. Thank you for keeping that with her. Thank you very much. Wherever you need to engage, you can, but we will allow that. The committee will be able to lead in questions. Honorable Randall.
Yes, thank you, Chair. I think we more or less covered, but for record purposes, let me just ask the question. It's with regards to the legal department's human resource that's incapable at the moment, or that was highlighted by the AG to deal with medico-legal matters. And my question then would be, please provide the committee with the intentions of the department, if any, to build the capacity of the legal department's human resources to deal with these medico-legal matters. If HOD want to expand on an earlier answer.
Because I think the first question, we're more concentrating on what's happening in hospitals. Now we want to focus on the department at provincial level now, the HR department at provincial level.
Chair, HOD is going to take that one.
Thanks, MEC. Thank you, Chair. Honorable members, Honorable Member Randall, I understand the question is as human capacity building in the legal unit. The department is currently in the process of reviewing the organizational structure, which was last reviewed in 2006. We're at a point now where we have all of the units revised, especially at central office, and also in some of the hospitals and districts. And the plan indeed is to make sure that the legal unit is one of the key units that we have identified capacity constraints. But in the immediate term, as I indicated earlier, Chair, is to get assistance from the Office of the Premier through that official we have identified to assist with the mediation. But in the broader scale of things is the review of the structure, which we plan to complete by end of December. We're working closely with the Office of the Premier, which needs to support or approve the plan, and then it gets sent to the DPSA. DPSA is part of that process as well, and the legal unit is one of those that will be receiving more capacity. Thank you, Chair.
Thank you. Any follow-up questions? So, MEC, maybe as a follow-up question, we know that, as you say, you are revising the structure. We got a report last time that one of the problems was you didn't have an HOD, now you have, but there was a bigger problem with finance, CFO. Are we still acting, or what are the plans? How far are we with that? Because if there's a problem with CFO, then financial problems will always be there.
Chair, I think, Chair, we still have an acting CFO, but because you remember the CFO has been on suspension. We're waiting for that report from the SIU, and then we can take a decision after. So for now, Chair, we'll still be having an acting CFO. Okay. And we are building capacity even in that unit, Chair. I'm sure soon HOT is trying to set once we finalize the issue of the structure, we'll start strengthening that unit. Thanks, Chair.
Okay, let me ask Honorable Kekane to ask the following question. Then after that, you'll remember Atkinson will ask the next question. Honorable Kekane, it's on payables which exceeded voted fund.
Thank you very much, Chair. Yes. My question relates to the fail of the department to pay suppliers within 30 days. We are aware that 3.4 billion was outstanding, which exceeded the 30-day payment window. So we just want to know as to how the department, is going to be able to pay suppliers within the 30-day period as required by legislation, and how the department further intends to address this problem going forward. Thank you.
Over to you, MEC.
Thanks, Chair. Acting CFO is going to speak on that issue of 30 days payment. CFO.
Thank you, MEC. When it comes to this issue, I think the biggest challenge that we currently have is the old invoices, which is we call them accruals. But what we have done as the department, we have then looked at we've designed a strategy where we looked at the cash that we have and the number of suppliers that we have. The first part that we have done was to engage a certain threshold of amounts of certain suppliers to negotiate and have payment plans. The second part was that we look at the critical suppliers, like your food and other items, consumables, to say let's classify these suppliers as critical suppliers, and so that we don't get to a point where we're not paying them and then hospital suffers. The third part was we look at the lowest threshold from 1,000 to 500,000, from 500,000 to 5 million. We ensure we clear all those service provider. So far, Chair, it's working, and it has assisted us in actually having a bigger cash flow than what we used, because the bigger suppliers, we are paying them on payment plans. So then it gives us an opportunity. Instead of having 324 million, last month we were able to have 442 million to actually pay the suppliers. And in terms of numbers, we used to pay about 60 to 300 suppliers. I can say in the last 2 months, the first one we pay over 1,000 suppliers. The second month, I think we've paid about 892. So when it comes to compliance, if the invoice, another area, if the invoice has been loaded and has been there for a while, it becomes now tricky to be more compliant, not unless we get to a point, where we can clear those accruals. But what we're advising was, when we have investigated in terms of our web cycle, we've then realized that there are a number of invoices that were loaded onto our system without sufficient documents. So what we have done, which is we're monitoring weekly, we look at cases like that and advise service providers to put additional information And also, we train them on the EIS system. So, and that is starting to show sort of results in terms of the reduction. But when it comes to compliance, because we've got even invoices that are backdated as 2020. Thank you, Chair.
Any follow-up questions? Maybe from my side, MEC, is the following. In my understanding is that you've got the backlog, and if you had paid those people, you would have also overspent, which is going to be an unauthorized expenditure. But this backlog dates back from even previous years. So you've got this amount that I'm not sure how you're going to handle it. I think that's something that we need a plan on. How are you going to make sure that you pay this outstanding service providers without affecting your budget in the future? I mean, the future budget, because that's the big problem. It looks like you already are going to be spending on the budget that you still haven't received. That's the first thing. The second thing is that, how sure are you that the service providers you are paying, I'm not talking about compliance issues, I'm talking about the issue that has always been raised, that sometimes some of those contracts were not properly acquired. Maybe there were some of them, they were not properly approved. So you might find that you've got a lot of, I'm not saying you have, I'm saying have you been able to assess if you are paying service providers, some of them maybe they didn't overcharge you. Are you having that system? Because maybe if you can look at that, you can find out that some of the monies you have to pay might even be less than that. It's something that I'm just looking at if you have been able to, as you pay, assess that as well.
CFO will answer that one, Chair, because I know that.
Before the CFO answers, Honorable Ncube wants to say something?
Yes, please, Honorable Chairperson. Just in addition on what you are saying, Honorable MEC, in the previous administration and the other one, 2014, 2019, there has been a great challenge of the accruals that brought the department into its knees. Attachment of furniture, removal of key things in the hospitals, which we were found wanting. So, and then there was also an intervention from the Premier's side in order to help and pull up the health department. As this is happening, I see a danger again to say we're getting into that position. Thank you very much.
Over to you, MEC.
That will not happen, that one. That will not. At least that's the area that we are all hands-on on. We have weekly meetings that we have discussions on the financials. Last week we had a session with the CEOs of hospitals and the CFOs, which we call them managers, finance managers in the hospitals, specifically on this area, that we don't want anyone that will misuse our funds now. We want proper systems that CFO has done. We have plans on how we're going to deal with that, even deal with the issue of accruals that can take us to that dark hole that we want to get out of it. And I can safely say we are going to move out of that dark hole. In fact, they are saying that, I was telling HOT that they are saying that the only thing that I speak of is the finances. But I think that's centrally to that department in terms of management of those finances. And I think we're moving closely towards that, including, Chair, the verification of every invoice. We don't just press the button. Each and every invoice, even if it was 2013 invoice, as you find some of those, we do verify if the work was done. I'm sure you will get a problem from DID because there are some invoices that we're not paying them because we still want to verify if those invoices are the correct invoices. Because on our side, we don't see the work that they've done based on those invoices. So we put them aside. So on that one, we're clear. GPT is assisting us even identifying what are those big projects that they said they've done? Because GPT is going and check. Even on our side, we're working very closely with them. But I think, CFO, you can finalize our plans of briefing the committee. What is it that we're going to do to avoid the issue of accruals?
Am I correct, MEC, to say GPT means Gauteng Provincial
Yes,
Treasury? Oh,
Gauteng
okay.
Provincial Treasury. We're working very closely with them, with the help of MEC Mamabulo. Thank you. In fact, in some of the issues, he's helping us a lot, including this recent one of Tembisa that we're handling with him in terms of clarifying and clearing some of the things that should have been done in Tembisa and putting up controls. Thank you.
So I think the MEC has covered me in terms of paying. Maybe what I can just say in your direct question, Chair, how do we ensure that we're paying the right people? I think that's what your question states. We have a verification process where even we pull out some of these service providers that were blocked by SIU during the PPE era. So we do have that verification. And when it comes to payment, we are very strict in that. And also Treasury, who actually does the actual payment, they do verify. Now, when it comes to accrual, we've put down a plan, and which is, I think, we've implemented I think it's the second month, where one, in all the institutions, we have now requested, in fact, they submit all their procurement for the remaining quarter, and then we assess that to see if what they want to procure, is it actually in the procurement plan, is it budgeted for? And in cases where we find that these things were not budgeted for, we decline and then advise them as to how is it that they should do to actually get those projects. That's the first part of controlling the future in terms of recurrence. The second part is we then, when we, these are funds that have been there, which is your question, how do we then make sure that they don't affect the new budget? Unfortunately, Chair, they will affect the new budget, but I think the way that we are doing in terms of having payment plans, so that they don't, even if they affect it, they don't affect the severe or the monthly cash flow. So we have tried and also looked into areas whereby institutions that where we see that it's not necessity to procure these things, and then we can see how we can then finance these accruals. But we finance them through a payment plan on a certain percentage, so that they don't affect our budget. But coming back to the controls, we then went a step further, established and trained committees, bid committees in the institution, and encouraged the institution, which is our hospitals, to first consider the contracts that we have been awarded to buy from, rather than have this split cost, having everything at 500,000. So we have then, from last week, we've been implementing what we called market analysis before procuring anything, because according to hospital, especially some hospitals I can't mention, everything is 500,000. So we then went into those hospitals and saw that the CEOs understand the oversight on these transactions, the CFOs and the directors, SCM, that they need to stick to the budget and the procurement plan, and also do a market analysis in any of these transactions. Thank you, Chair.
Thank you very much. I think, MEC, that's exactly my point, that especially what happens at the hospital level. So would your boards have a capacity to assist the department in monitoring that spending or ensuring that everything is below 500,000? Would your boards have capacity, or are they empowered to intervene in that regard? Hospital board.
I think, Chair, with the meeting that we are going to have beginning of December, it's exactly those issues that we are raising, that we want to empower them to be able to look into the oversight that they are supposed to do in every hospital, because some of them don't understand what is it that they must do there. then the CEOs, the CFOs, in fact, even the CEOs, Chair, what we have realized, some of the CEOs are overpowered by the finance managers in the hospitals. They don't even know how much is being spent by the office, by the finance manager in the hospital. So now we're opening their eyes that your responsibility, every month you must get a financial report from the office manager, but even the board chairpersons and the board members, we are going to empower them to ensure that they do understand their role and the expectations thereof. But we'll be working very closely with them because we have a team that must help them, even from the national office that is under the office of Dr. Snaba, I think it's COO, yeah, other COO, so that must assist them to ensure that they know their role, they understand. So our first meeting will be more of a workshop that we are going to do, including clinic committees, because there are clinic committees that are interested in ensuring that our clinics are run properly, but now we have more, our role is to empower them, capacitate them to understand the check. So we'll definitely do that. It's part of the issues that we must address in the meeting that we'll be having. Thanks, Chair.
Thank you very much, Honorable Atkinson. Then Honorable Ngube will ask the next question. Honorable Atkinson. Welcome, Honorable Dow.
Thanks very much, MEC and HOD. MEC, I think we saw the one side of the problem on the Finance Committee when we were looking at the very late payment of the invoices by health, and now you're sitting on the other side of the equation and having to deal with it, which makes a very interesting situation for you. The other side of the equation is this issue of material impairment. So we know that there's not enough money to pay that very large amount outstanding. It exceeds the amount of money in the budget for it. But on the other side of the equation, we've got a lot of money that hasn't been collected by the health department, and that amounts to 3,195,452,000 allowance for impairment. Okay. So what we'd like to understand is, why is the department unable to collect this money due? And what is the department going to do to address this matter? Because if we were able to get some of that money, it may well go some way to helping the problem with paying that very large outstanding amount that we owe in the earlier question. Thank you.
Over to you, MEC.
Thanks, Chair. Before I even hand over to CFO to answer the question, I want to forward the apology. HOD have just released it. There's that issue of Tembisa, and they're at the Labour Court today, so she's just taking a call to discuss with the team from the Premier's office about the issue.
Okay.
CFO, can you answer that one?
No, thank you, Chair. I think most of our collection, first part is they relate to RAF. And one of the biggest obstacles...
What is RAF?
Road Accident Fund. Sorry, Chair. Sorry. Yeah, no, apologies. So one of... most of our collections do sit with the Road Accident Fund. And one of the challenges that we have is that they've changed their requirements when it comes to claims. And one of them that we found them to be upset and not assisting us is the fact that if there are claims, they require even sketches of vehicles and accident report, which is that can only be done by the drivers. Even the police station only allows the drivers. We have since then returned we ask our legal system to actually assist us in requesting an exemption around these requirements for Gauteng Department of Health. And the second part, which is, Chair, that is difficult to look into, is tracement on people that are giving us false information and illegal foreigners. So you'll find a bulk is also sitting there. We look at this billing, but we can't trace even the address. The phone numbers are incorrect. So we think that the new system that is coming through for automation that will require a more detailed information, it will ease up this backlog. But it's in those two ways the road accident fund and the tracement of information. Thank you.
Thank you. Any follow-up questions? Okay. Honorable Mncube, you ask then after that. Honorable Dilang, you'll ask the next question. Honorable Mncube.
Thank you, Honorable Chairperson. With regards to the underspending of the vote, Honorable MEC, could you provide the committee with details for the lack of effective monitoring of budget by the department, and also the implication on service delivery where the department underspent 624 million on program 2 district health service? Thank you.
Maybe before you respond, what is District Health Services Program in a nutshell? What is it about, the District Health Services Program?
HOD, can you clarify this one of what is district health services? And then HOD, services, acting CFO will speak on the underspending.
In a nutshell, what does it do, that program 2, District Health Services?
Yeah.
District Health Services, Honorable Chair and members, is a program that manages district-level hospitals as well as programs in the 5 health districts in the province. It's primary health care largely, but district-level hospitals. We have, and I hope I'm correct, 12 district hospitals and about 372 clinics, 33 community health centers. And all of that program is responsible for that. The challenge is in relation to managing the data, the information are in that platform, Chair, if I may.
CFO, underspending?
Okay, I'll speak specifically on this vote, Chair. I think one of the biggest contributors was the due to the medical supplies commitment, where one instance where there were no supplies for condoms in the entire country with the contract that we have. So that also affected that particular vote. The second part is also the antiretroviral viral treatment, yes, ART, sorry, acronyms. So there, we were given funding on top of what we have. The National Department of Health assisted us with funding. So it took some time for us to have our own funds to kick in. And in terms of managing the budget, so what we have established, what we do as the department, we've got monthly variance report, where in each and every month, we look at the budget versus actual. And then where we are lacking, we are not spending. That's when we are punching holes and also monitor that underspending. So we will not, at the end of the year, we hope that we will be able to spend 100% on this particular area. And we report on this on our executive management. Every month we report to Treasury. We report also to the Department of Health that is visiting us tomorrow on the same issues around the spending on this area, Chair. So that is the control that we have on top of what we've experienced. Thank you.
Let me see, there was a second part to the question about impact on service delivery. Now that there's this underspending, and I'll also, yeah, there's something I want to ask, but depending on the response.
Can you answer that one on the impact on service delivery, the spending, program 2, because we're not spending?
Honorable Chair, we have not really assessed the direct impact of underspending in terms of linking the effect in a straight line, bold line, the money and the program. What I can say though, Chair and honorable members, is that during COVID, some of the programs at district level actually were affected in terms of implementation. And we are now beginning to recover from that situation where the focus was mainly on dealing with the epidemic, and we lost expenditure, implementation and expenditure during that period. And we see that also, Chair, I have to say, in the performance on those programs where the ART that CFO was speaking to, people are not complying with treatment, even TB has been affected, immunization for kids in some instances has been affected. We're beginning to see cases of measles where we're not supposed to be seeing them. So there has been an effect, Chair, and we are working to intensify those programs in a program called De-escalation and integration. De-escalate the COVID intense program and integrate it into the regular services with others. We should be seeing, Chair and honorable members, improved expenditure and improved outputs on programs going forward. Thank you, Chair.
Okay, as we take the next question, you don't have to respond to this one. I would have thought that if one of the underspending is as a result of shortages of condoms, it would have been easy to assess service delivery issues, impact. But let's not answer that. Let's move to the next one. Honorable Dilange.
Thank you, Chair. MEC, HOD, in terms of compliance with specific laws and regulations, we noted recurring procurement and contract management issues. Please provide the committee with explanation why the department is unable to prevent the following 4 incidents related to procurement. One was transaction value above 500,000, procured without inviting competitive bids. We noted, and then deviations approved by the accounting officer, although it was practical to invite competitive bids. Contracts awarded to bidders who did not submit a declaration on whether they are employed by the state or connected to any person employed by the state. Contracts awarded to suppliers whose tax matters had not been declared by the South African Revenue Service to be in order as required by Treasury Regulation 16A9 1D. And then we realized that this is a similar finding for medical supplies depot. Please elaborate on this matter as it relates to the MSD. Thank you.
Over to you, MEC.
Thanks, Chair. Acting CFO is going to take that one.
Thank you, Chair. Maybe I should just put it, when it comes to these 500,000 RFQs without competitive bidding, I think we, as a department, we have now put controls that I've alluded to earlier, and we have realized that the bid committees or the SCM processes at institutions were not up to scratch. And in resolving this, we set up committees, we've trained them around this area to ensure that the bidding is competitive. It's not a matter of you hire who you know or your friend. And the second part, deviations do occur, but what is important is that deviations should actually meet the requirements of the deviation, being the emergence or exhausted all other alternative, and you have to only seek that deviations. So in all the deviations that have taken place within our institutions and the department, there were reasons around that. And what we're doing now to ensure that we don't appoint companies that are connected to the state. So we have changed with our new controls, we have changed our checklist, and we have implemented, there's a DPSA type of system that they have allowed us. So if you come, you're tendering with us as a company, we're able to punch in the numbers of the directors or owners of that company. And the system can tell you whether the person is employed or connected to the state. And what we do in all of those transactions, we do have a printout for auditors to say that we have done our part as part of our checklist to avoid people who are employed or connected to the state. And with the competitive bidding around MSD, HOD, I will ask the CFO at MSD to actually deal with that particular question.
Over to you.
Chair, Mr. Mahleza is here from the MSD through you.
Thank you, Mr. Mahleza. Introduce yourself, then respond to questions.
Thank you very much, Chairperson. My name is Xolani Mahleza, Director of Finance at MSD. I'm going to respond to the question around not inviting competitive bids for a procurement above 500,000. The only, what AG is actually referring to the extensions of contracts in the context of MSD, which we participate on. These contracts are centralized at the departmental level. So I know for the fact that there are plans from the department to address all the contracts that have been expired. I'll stop there, Chair. Thank you very much.
Any follow-up questions? Honorable Kekana?
No, thank you, Chair. Yeah, just for interest's sake, Chair, I just want to check with the department. I know that according to regulations, there are certain levels of managers who sits in these bid committees. I just want to check if you have looked at a system where you could rotate some of these managers who sits in the bid committees, just to avoid permanent people sitting there and the risk of them getting too close to service providers to an extent that some malfeasance can take place in that space. And I also want to check on the blacklisting of companies. You find that a company submits or tenders with different companies, but he's the sole director of the 3 or 4 companies, for instance. Are you able to pick that up? And if you do, to what level, to what extent are you able to then blacklist such companies who are trying to defraud the department? Thank you.
Over to you, MEC.
Thanks, Chair. Honorable Kekana, it's like you were in our meeting 2 days ago, because that's the issue when I was wrapping up the meeting that I've raised, picking up issues that we have not done on the rotation, because you can't sit on finance, SCM in particular, for more than 10 years. In fact, I call them Kibo Khale Kilimo. So I've said to HOD and the team, let's do away with Khale Kilimo. We're going to rotate them, especially because we know there are incidents, especially SCM, where people are doing wrong things because they've been there, they understand the system, and nobody can tell them. So we'll be implementing that. We're going to come up with a plan. Already HOD is working with acting CFO on that plan of changing those colleagues, because some have even identified areas where they must be taken to. Some must go to SCM specific, but including those that that lower level, they call them buyers. I've said we will start there, juggling them around. It's done in the departments. We did it in other departments where I've been, and it worked so well. So then, in the blacklisting, I know what we do blacklist companies, but acting CFO will talk about those companies that have been blacklisted in the department. Thank you, acting CFO.
Thank you, MEC. I think what the legislation does, there's 3 sets of committees. There's a committee for specification, there's a committee for evaluation, and there's a committee to adjudicate. But the most risky committee in all of this committee is the evaluation committee. So what we have done now as a department, in fact, the legislation assists us. We do not have permanent members of the committee of evaluation for each and every project. New people are appointed to evaluate just for that reason, to ensure that we don't have people who are permanent in that area that can be conducted and for whatever reason. So that's the control that we have for each and every project. We actually appoint new people with a clear mandate of what they need to do, and also in terms of their conflict of interest. That is also ensured that it is clearly determined, should it happen, that they must declare. Now, when it comes to blacklisting, we do blacklist companies through our Gauteng Provincial Treasury, where we have found issues or areas that requires blacklisting. Now, there was a question that was also asked in terms of how do we determine companies that are linked to be owned by one company, by one person, or similar directors? We do have those incidents, but how do we pick them up? We pick them through our internal control. Currently, we have a project that the Gauteng Treasury is assisting us, where we have close to 240 companies that are suspicious to be aligned, and we're busy with that particular audit. And how we've picked up with the similar submission, similar signatures and so forth. So we hope that the audit that is currently underway will prove us right, and then from then we'll find also better ways to actually avoid that, maybe improve more on our checklist, although it's not now viable to just check writing in each and every submission that you get, but we will put something into that effect. Thank you.
Thank you very much. MEC, okay, there's a follow-up question, Honorable Tilang.
Chair, thank you. My follow-up question is actually regarding the contracts awarded. If you wanted to ask something first?
No, go ahead.
I'm not sure. If we say contracts awarded to suppliers whose tax matters had not been declared by the South African Revenue Service to be in order as required by the Treasury regulation. In other words, we did follow up, but they were not in order. And I'm just questioning the fact as well, as we cannot, it's a prerequisite that we ask the people when they tender or when they apply for, to be awarded to suppliers. Anyway, but what we ask them is that they supply the document. It's part of a pack of a documentation that they're supposed to supply. If they do not supply it, we cannot just draw something from a system. And then we hope that SARS system is up to date. And I know the Kojima company as well and their systems. And we cannot rely on that. I think it's imperative, Chair, that the department understand that when someone are bidding for a tender, they have to comply with all the documentation and the requirements. We cannot exempt them because we have checked on a database, because we don't know where the information of the database is coming from, whether that is actually up to date or not. We need the documentation as we do with all of them. So I think we just need to make that clear, and if the department can just maybe respond on that again. Thank you.
MEC?
CFO will clarify that, because I think we do need that information. We don't rely on another system, even ourselves, who must be satisfied that this person provided all the necessary documents that are expected. But I think it's something that from time to time, as Member Tilang is raising, it must be part of our priority list. Acting CFO.
No, maybe I should just maybe start by saying that it is a requisite that when you tender with the department, whether from a quotation basis or a tender that is above R1 million, documents, legit documents or valid documents are submitted. Maybe let me start on top. In terms of the big tenders, we do require tax certificates to ensure compliance. And we can see whether it's a fake or not a fake tax certificate. I think with the people that we have enough quality when it comes to that. But when it comes to also the systems, we don't use any systems of any company to withdraw documents. So there's two ways that we check compliance. It's through submission and CSD, which is Central Supplier Database. And that Central Supplier Database, it's got clear requirements for a company to register there. And they register with valid documents, and it's monitored and managed and supported by the National Treasury. But on that one, we do rely on it because its requirements for a company to register there meet our requirements. And we will draw a CSD report, Central Supplier Database report, that will give you the address, the tax status, the owners, whether the person is working for the state or not. It's quite an intense a process if one wants to trade with the state, and we feel more comfortable because there's quite a test that has been done by that process. That one we do rely on. Thank you.
Thank you. Let me see, because of time, we're going to ask you the last question. And Honorable Kanyane will just ask that question. And if maybe you can respond to it briefly. It's a heavily loaded question, but if they can respond briefly. Honorable Kanyane.
Thank you very much. Yeah, it's one question with about 4 parts, but it's on the irregular expenditure, fruitless and wasteful expenditure. Now, if you look at 2021-22 financial year, you have incurred 2.57 billion on irregular expenditure and 17 million fruitless and wasteful expenditure. So the MEC, if you can just give us the root cause of that, and again, why senior management was unable to take steps against officials who permitted irregular expenditure. Now, again, just elaborate maybe your assessment on the capacity of the accounting officer to oversee and ensure effective procurement processes and compliance, as well as related internal controls. Again, we've moved further. We looked at the MSD. Same thing applies. Can you just elaborate also on this MSD? So those are the 4, I know you heard it, unless you want me to, but I think I've really put them very clear about 4 parts on this question. Thanks, MEC.
Over to you, MEC.
Thanks, Chair. Acting CFO, can you talk to that bullet question?
Maybe I should start here, Chair. I'll answer them, maybe not in that order. Well, I'll start with the irregular expenditure. The root cause of the irregular expenditure is contract extensions, which were caused due to inability or capabilities of the supply chain management to source new contracts. So all our irregular expenditure is not monies that were or transactions that were done without necessarily doing competitive bid, but they were extension. When they expired, they were then extended. That's what amounts to. And for us to correct this, we are actually regularizing some of these contracts. And as we know, Chair, that for one contract, the minimum time to actually get a new appointment it's about 3 months. We are capacitating our supply chain management so that we can try and minimize this particular area and the concern. So when it comes to fruitless and wasteful expenditure, this is as a result as a department where we did not respond or make payment arrangements on time to all the court orders and litigations that we have experienced. So that relates to interest. And we have since, Chair, with the mediation process and the conducting of attorneys of those that are claiming us to respond on time. And I know Gauteng Provincial Treasurer is also assisting because some of these orders do come firstly to their offices. And when it comes to consequence management on the regular expenditure, for one, to actually get irregular expenditure to be condoned, an investigation must be done. And consequence management then should kicks in. But I think I will allow the HOD to speak more on consequence management. And some of these irregular expenditure where they meet requirements of condonations, which is what I've just said. We have applied to the provincial treasurers, and I think of 2 of those contracts were condoned, and there are those that are underway for application, Chair. When it comes to MSD also become now affected by us as we are the contract holder for all their contracts and their services. So also it's the same thing, is the extension of this contract that really caused their irregular expenditure. But on the last part, number 4, I will then ask HOD and MEC to respond on the consequence management and the other question. Thank you.
Thank you, Honorable Chair, honorable members. Obviously, I won't be able to respond to question number 3, but maybe I should go back to answer the question of the Chair around the shortage of condoms without wasting the time of the committee. Yes, we do see a direct line with increase in pregnancy and high incidence of HIV, Chair. But on a serious note, if I may, request Mr. Matsandeng, our Chief Risk Officer, just to speak to the work that is being done around the matter of risk management and consequence management. Through you, Chair. Thank you.
Thank you, Chair. MEC and HOD, I'm Canada Matsandeng, the Acting Chief Risk Officer. Just to respond to Honorable Kanyani on the questions that he has posed, I think it will be proper of me to just to indicate, Chair, that it begins with the 2 ladies who are addressing you there. If both of your EA, Executive Authority and Accounting Officer, are not very clear in terms of what they are supposed to do, that's the beginning of the problems. In terms of what we are talking about. So the leadership and the trajectory that they provide is the starting point. 80% of all these problems that we are talking about would be taken care of. So that's the major risk, that over the years we have not been getting it right. And so that's the macro root cause of all these things that Honorable Kanyani is talking about: irregular, fruitless, and to a certain extent unauthorized. Why we have not been able to take steps against some of the senior managers who have been involved I think as far back as 2012, and then we have thrown this burden to the MSD. It's because majority of some of the people who have been involved in these incidents were some of the most senior people. And unfortunately, by and large, all of them are no longer here. So we can't effect a consequence management. We all know the implications of the law around that. If we have not been able to discipline somebody since 2012, we don't have a fighting chance to do that today. So I'm saying that's the first part that we need to get it right. How do we get it right moving forward? It's an ethical culture. We are not the Department of Police. We are the Department of Health. We're supposed to be taking care of people. So there's an aspect of the societal force on malfeasance and unethical behavior that as a department we are ill-prepared to deal with today. So it's a capacity that we are building with other law enforcement agencies, with the Office of the Premier, but it is a work in progress. It is at its infancy. There's also the question of the controls, internal controls that the AG has flagged, the CFO has spoken at length around that. I think this is a department where 80% of our policies and standard operation procedures have not been reviewed, some of them since 2012. So that's the reality that we need to live with. With regards to the capacity of the accounting officer, in line with the PFMA to ensure that he or she provides an environment that does not allow these things to continue. It's a function of both the leadership of the accounting officer and also the capacity that I've spoken about, and also cooperation with other stakeholders and other agencies, including yourself, in ensuring that you hold us to account. I think we have started well under this MEC and this HOD. They know what needs to be done. The MEC had signed an SDA with the Premier, so the MEC cannot allow managers or officials who are incompetent or who are not capable of doing their duty. So that's the beginning, Chair. So I'm saying we are on the right path in terms of where we need to take this department. I mean, I've been in this department when this department was at its best, and I'm with it when it is on its knees. So I'm saying for as long as the MEC does not allow officials not to do their duties for whatever reason, this department has a fighting chance of getting all the things that the committee has raised right. Thank you, Chair. I'll pause there.
Thank you very much. Any follow-up question? Honorable Tilang?
Chair, thank you very much. I cannot say that I'm perturbed, or I am perturbed with the answers. If someone works in this department and he gets redeployed somewhere else, that does not exempt him from wrongdoings in this department and that must stop. It's a sick climate that we are treasury in this government, and it should stop. We cannot have people disappear. What are we saying to the public now today? You can say and do what you will. Do not do your job before any harm comes to you. You're gone. You get sent somewhere else. We hide you. No, Chair. I do not accept this. Thank you.
Okay, maybe let's put it into perspective, Honorable Tilangi. I think that if somebody is working for you and they want to resign, you can't say they shouldn't. That's the first problem. I think the second issue is capacity to investigate where there are issues of unauthorized irregular, fruitless, and illegal expense, so that when people leave, if they are under investigation, the good thing is that there are now systems that are in place. People can, their pensions can be affected and all that. So I'm saying what is important is, I don't think that the department, I don't think that's how we are putting it. Not that the department says, because there's wrongdoing, you must leave. No. What I think is that people resign on their own accord. But we need a system that's going to ensure that even when we have resigned, we still can follow up on issues. And I think already there's something that is being done around pensions. So it's still that, let's discuss it as a committee and make some recommendations when we discuss the report as a whole. MEC, thank you very much. I want to open out to some of our stakeholders who are here. I want to ask them to be very brief and to the point because we are under the pressure of time. I'll start with MEC Mamabulo, and I'm hoping that he'll also be brief and to the point. MEC Mamabulo.
Good morning, Chair, and to honorable members. I'm sorry that I'm speaking on a matter you have closed, and I realize you don't have time. But on this issue, Chair, of that Honorable Kanyani has asked about and how the department has responded, I think, Chair, we need SCOPA to be very decisive on this issue. And I think for me it belongs to SCOPA. You know, I'll just conclude by saying, because you have already said you'll deal with it and come back, but, you know, Comrade Honorable Parks, Dow, the Chair of Finance, sorry, Honorable Dow, I thought we were in another meeting, sorry. Has raised one concept which has really made me to think quite seriously in one meeting of the Finance Portfolio Committee of collectively presiding on collapse. That all of us are accomplices in collapsing a system. And we just work together to collapse it. So I think SCOPA has to raise the bar on dealing with lack of consequence management. You are a portfolio committee. You are a very important oversight committee. I think we need your recommendations, Chair. Very decisive, very clear, very robust and thorough, so that we are not accomplices in presiding over a collapsing system, and we just all you know, look at it happening. I'm sorry to belabor the point, but here I am pleading and challenging, not in a bad way, SCOPA to help us. That's all I wanted to say, Chair. Thank you very much.
Thank you very much. Let me see if there are on the line. I'll come to those that are in the members of MPEX. On the line, is there anyone who wants to make comments? I'm just checking at hands. I don't see any, so I'll move on then to in the house here. I see one hand. Is there another hand? Members of MPEC. You are from the MPEC. Is any other member of MPEC wants to make a comment? Okay, over to you. You are the only one, then we close on this matter.
No, thank you very much, Chairperson. I'm very worried about the comment that was made by the Chief Risk Officer. And I also agree with the point the Honorable there has made and what we have also alluded. My comment or input is based on, I want to check what system do they have in place with regard to recovering the money that was used or misused. Actually, let me say misused, because it can be correct. He said that they're unable to apply the consequence management because of other officials were redeployed somewhere whatsoever. I want to check the system that they can use to recover the money, because we also highlighted on the issue that there's pension funds whereby if they do apply the consequence management, the pension fund can be freezed while the investigation is still in progress. So what do they have in the office? Because I didn't expect such a comment from the Chief Risk Office. Thank you very much.
You didn't introduce yourself?
Oh, my name is Councillor Retabile Hlakane from Mfulweni, and also a MPEC member.
Thank you very much. MEC, if you want to respond to these comments and also make your closing remarks at the same time, because we've now come to the end of the public hearings.
Thank you, Chair. I know that we have systems to recover the money, but I want to propose that I can, Chair, assist us in some of the recommendations. But it's unlike we don't have systems or we transfer people to specific areas. I know even 2 days ago in our meeting, I've asked for all the recommendations where we should be implementing those recommendations that are coming from HE, from forensic, that have consequence management, because we're going to act. And I think at some stage, let's come to you and identify those specific cases that we are acting on, because we're not scared of acting and we can't transfer the responsibility to another area, and we do have criminal charges. People are being followed already as we speak, where we know that there are some wrongdoing that they've done. So we do have systems, Chair, and I think maybe Matsaneng was not specific in terms of the how part, how are we doing it, but we are working on that. I will be acting because some of them are supposed to come to me. I'm the one that must do the final clearance from HOD. What must we do and who must we chase and how do we get that money? And we're going to get it in every person that has done a wrongdoing in the department. In fact, I was telling them that's one area that I'm not scared of making sure that I do follow-ups to people that are doing wrongdoing. Because if we don't have consequence management, we will be collapsing the department indeed. And I think SCOPA, once now that recommendation comes from you, it will give us more strength and more backup in terms of acting. I'm not sure, HOD, if you can just, there's something that you want to say.
No, I can't add to that, maybe except to say we're committed, Chair, to implement consequence management. It's a lot of work that gets done by our health professionals on the ground, and we owe it to everyone in the country to make sure that there is clean governance in the department, and we are committed to do so.
Thank you very much. Let me take this opportunity first to say, MEC, that there are some other matters wanted to raise with you. Because of time, we're unable to. We will send them to you in writing. And so that we expect that, unlike the previous times, HOD, the responses will be on time. You know what I'm talking about. They'll be on time, because we need to produce our report that must go to the to the legislature. Secondly, is that we appreciate the fact that you availed yourself, MEC, and that we acknowledge that you are new. When I say new in the position, you're not a new political leader. You've been even here, and that the HOD also came after the end of the current financial year that is under review. We're hoping that you'll steer this ship. This is one of the difficult departments. And we as SCOPA, we have committed ourselves through our oversight that we will not wait up to the end of the financial year, but we'll continue engaging with you throughout the year. We will discuss some of the proposals and we'll be able to raise them with you so that you can be able to respond to us on time. Let me take this opportunity to thank you then for availing yourself. You are now released. Honorable members, let's take a 15 minutes break. The time now is 11:40. Let's come back after 15 minutes so that you can deal with human settlement and housing fund. The meeting is adjourned. Human Settlements and the Housing Fund. Can I have order, please? We are in a session. Please ask those that are coming to understand that we're in a session. May we have order, please, right at the back there. So we will then have to ensure that, okay, the problem we have is that last time we had agreed on questions. Please, may I have order there? Last time we had agreed on questions to be asked by which member. Unfortunately, some of the members are not there. So what we're going to do, we're just going to follow the chronology of the questions as they are, and we'll take it from there. So it doesn't matter. So you don't have to ask the question you asked before. It might change. It's one question after the other. There is a possibility that we might not get very far on the questions because we'd asked MEC Mamabulo to mediate between the department and the office of the AG, but because of the medium-term budget statement, whatever, he was unable to. That's why he's here. So that I think one of the things we might have to do is, depending on the discussions, we might want to take that route, maybe not continue the questions, but let's see how it goes, and we'll take it from there. Thank you very much. Are we agreed? Do we all have the questions? Simon, we've sent all. Mumpat, you sent all of them? Okay, thank you very much. Let's ask the department to come. So you've got the questions, so we'll start Honorable Kanyane, Honorable Tilangi, Honorable Randall, like that. We'll go like that. But if we have to stop somewhere, we'll assess it and then take it from there. Okay. But I'll ask the first question about the housing fund, then we'll get to the other one after that. Okay, thank you very much. Let me take this opportunity to welcome MEC Maile and both the officials of the Gauteng Housing Fund and the Gauteng Department of Human Settlements. Just for your information, Honorable Maile, in the meeting we also have chairpersons of MPEX, who are our partners. Based on the issues of, they are disturbing you. I don't want them to disturb you. Okay, sure. Yeah, so it's we've got chairpersons and representatives of MPEX, who are our partners, and also we have the MEC for Finance, Honorable Mamabulo, who has joined us. We also have in our midst the representatives from the Gauteng Provincial Treasury, who are always assisting us in understanding some of the issues. They were delegated by the MEC. And then we've also invited the Office of the Auditor General of South Africa. So we are all here. So This is the second public hearing we're having. The intention was that you must start at 12:30, and I want to apologize, but I can assure you, we will be done by the time we promised you. We said we're going to go until 1, so we'll start wrapping up around 1:45 so that we're done by 1 o'clock, as promised. Let me then ask if, I don't know if you've got any opening remarks you want to make on MEC?
No, thanks, Chair. Because we started late, we rather get into the business, and if there's issues that needs us to respond, we will respond. Thank you.
Thank you very much, MEC. We are not expecting a presentation from yourself. We will ask questions. So maybe the first thing we want to deal with has to do with the housing fund. May I ask that the doors be closed because the noise outside is disturbing us? We want to start with the housing fund. We've noted the audit outcomes of the housing fund, and it's a disclaimer, and it's been consistent. The last time we had an engagement with you, MEC, first there was a view that there are moves towards closing the housing fund. But then in our last engagement with you is that you said you've investigated, you think that the housing fund is something that legally must be, and if I'm quoting you wrong, you'll correct me, legally must be established, it must be there. So you've asked that it must be recapacitated, the organogram be set up. And so I know when we spoke to you, it was after the end of the financial year that has been audited. So things could have changed after that date. So if you can give us a sense, how far is that process? Where are you now about it? Are there other new developments as it relates to the housing fund? Over to you, MEC.
Thank you very much. Yeah, you are correct. The housing fund is established by the Housing Act, I think 96. So we must have it. And hence, in our submission to DPSA for the organogram, we have created the housing fund as a branch, meaning that we will have a DDG responsible for. Am I right, Pule? Yeah. So we'll have a DDG responsible for the housing fund, and that organogram has been provisionally approved. I'm saying provisionally approved because DPSA has given us a response with minor suggestions and amendments on the organogram, but that part of the fund is provisionally agreed to. So it took a bit of time to create the fund, the organogram, sorry, because there are processes that are followed through the Premier's office and submitted to DPSA and the officials and all that. So they only came back to us, I think, last month. So it's only now, 7th of November, yeah. So it's only now that we are able to establish as a unit, as a branch in the organization. And then it will be given those the attention it deserves. But you will remember, some of the problems about the fund, it's the fact that you've got sectional titles that people don't want to take responsibility for, and they are accounted for. Unfortunately, we must pay the rates and taxes that are in our asset register, and they have many other issues that you will raise. So establishing it does not necessarily mean that you will solve all the problems, but it's important because there will be a unit on a daily basis dealing with those issues. Thanks.
Just so that we're clear on, sometimes the language is another thing. So as we speak, the housing fund exists. There was the attempt to try and wind it out, but with the intervention you've made, you are reviving it. I want to be sure that we're not talking starting from scratch, or are we talking starting from scratch? You are reviving it. That's why you're setting up the organogram, and all those processes. I don't know if, I want to be sure that the language that we're using is also clear.
Yeah, when you go to Hansard Chair, in the chat we had with yourselves last year, when I gave you a briefing about the problems and the challenges and what's happening, I explained that when we came in 2019, there was an idea that we must do away with the housing fund. We then realized later that we can't unless we amend the act, and therefore we had to revive it, because the process of winding it down had started since maybe 2018 or 17. That process had started. And we then realized, I think, year 2, that no, but the law doesn't allow us unless we amend it. So what we are doing now is to revive it, yeah. So there was no activity taking place in the fund at all, hence the disclaimer. And the disclaimer, anyway, comes from all the previous years, the assets, how they are managed, and all that. And I think it's some of the issues we raised with the AG in terms of how they must be managed and all that. But we are aware of the challenges, and we agree that there are challenges, and those challenges must be dealt with. We might differ on how do we deal with them, but we all agree that they must be dealt with. So we are, yes, reviving it.
Any follow-up question, honourable members, on the housing fund? We will go back to specific questions later, but for now, we just wanted to find out on this approach. Any follow-up questions? Okay, there aren't any. So we will move on then, honourable MEC, to the, let's start with the Gauteng Department of Human Settlement. We have received a response to our questions. We have looked at them. And on the basis of that, there are some follow-up questions we want to engage you with, so that we get clarity on some of the things. I want to ask Honorable Kanyane to start.
Thank you very much, Chair, and the MEC and the team. My first question, it is based on the department for their delay in tabling the 2021-22 annual report. And our question, we wanted to find out the details. Why was it really tabled late? But the department has responded. They made mention of the fire at the Bank of Lisbon. Now, as a committee, we are saying, why is this finding recurring, which started from 2018? Because as a committee, we thought, because there are service providers that we've contracted, then it would be possible for the department to retrieve copies signed with those service providers. But we just want to get maybe a clarity on it in terms of this delay, and if ever this matter is still persisting, it's a problem. I think that's what we wanted really to clarify as the committee. And the other question is on the informal settlement upgrading partnership grant. We have just gathered that we have really underspent. If you can also elaborate on it, the issue of the underspending, how did it happen? So those are the two questions, Chair.
Over to you, MEC.
Thank you very much. I think the issues we are raising with the AG are precisely about the question you are posing. These are recurring findings emanating from 2018, and as you correctly say, we even hired, so our posture has been that we are a successor in title and in law. Fortunately or unfortunately, myself, the HOD, CFO, and I think some of the DDGs were not even there. But when the AG raised the matters the first time, we never said it's not us, we are not there. We understood that we have a responsibility to, we have, and we cooperated. We said we will do whatever that the AG wanted us to do, get service providers, we got them, tried to retrieve as much information as possible. 3 years later, the matters are recurring. And those matters have an impact on the audit outcome of this financial year. And we think that that's not fair. Hence, we raised the issue with the AG, and hence the delays, because the accounting officer had taken a decision not to sign and concur with the report of the AG, which I supported because of the reasons given. But for purposes of the process, the report must be presented to the legislature. She ended up signing, not because she agrees with everything that is in the report, because the AG's report has to be based on facts, not on what the people who are auditing believe is their interpretation. So there are areas where some of the people in the audit are raising issues of interpretation. So what we then decided to do was that we will seek counsel of external stakeholders to advise, and we have received preliminary advice on, I'm saying preliminary because it's not finalized, both from the senior counsel point of view and from the accounting point of view on the issues that we are raising. So from where we are sitting, there are issues which external advice says, we think you have a point here, and this can be pursued further. Hence, we're saying that we want the report to be reviewed. But what does review mean? Review can mean get an arbitrator. It can even be a panel that is legal and accounting people, whatever. It doesn't, in fact, court process, it's out of question for us. Hopefully the AG would agree for that process, because we really want to put these matters to rest. And the AG knows how we have cooperated from day one and how we have helped and acted on a number of issues that are being raised. So this issue of the recurring audit outcome, Honorable Kanyani, it's a concern to us, and it's not like we have not been dealing with these issues. We have been, and maybe the CFO will add in addition on the informal settlement grants. I think maybe it's a portfolio, maybe it's our portfolio committee that we would have had discussions with them on how this was firstly a new grant in that financial year, and all provinces, there was an issue in terms of what must happen. But one of the things that played a part in our understanding, we then thought at the time that we will procure the land that was meant for Mamelodi flood victims. Am I right? Yes, Pinas something. And there was a process, so I don't want to come with long stories. So there was a process which was started in Tshwane, because we were procuring through Tshwane. But you'll remember, Tshwane, there was administrators and blah, blah, blah. Cut the long story short, when the mayor came back, the mayor decided that, no, there's a problem with this acquisition. The mayor investigated. The report came back and said, in fact, because we had procured through the HDA, in fact, the land was cheaper And then I spoke to the mayor. We called the meeting. Mayor, what's the issue? The mayor says, no, we don't have the money to buy the land. We said, it's fine, we'll give you the money. When we're supposed to give them the money, the mayor says, no, I don't want this land. We want to start process afresh, this and that and all that. When we had actually started with the HDA, we then gave the money to HDA. The HDA proceeded. From next week or so, we will be relocating those people after so many. So it's a big story, a story that I don't want to come. So we were disorganized because some of our spendings are dependent on external stakeholders like municipalities and implementing agents. So we can't give a municipality money if we are not sure if that money will be used for the purpose that is meant for. As you know, there are a number of municipalities, you can count them, in fact, almost all of them. We have given them money in the previous financial years. They've still not accounted for that money today. So even the AG is very, a national department of, because our budget is a grant, it's very circumspect in terms of how we dispense all this. So unfortunately, that's the excuse, and that was the 200 million which was underspent, which was meant for that land parcel, and we could not give money to the HDA before the process is finalized, because when you do that, it's seen as a dumping, one, and they must procure first and then invoice us. And so it's just a technical thing. It had nothing to do with our inability to spend the money. It was about processes, because, unfortunately, you always have to strike the balance between spending and making sure that there's value for money, processes are followed, and you don't pay in advance. Yeah.
Are there any follow-up questions from members? Honorable Kekani, Honorable Randall, Honorable Tau.
No, thank you very much, Chair. I just want to check with the MEC in terms of the municipality, especially as it relates to Tshwane, not having money to relocate residents. And I think it also happened in terms of the transport, in terms of the people who have encroached the road in Tshwane. I just wanted to check, Hori, as COGTA, I know you are no longer MEC for COGTA, but these are things that happened when you were still in COGTA. To say that if the municipality says they do not have money, and yet they have the USDG grant, which they have not spent, and then I heard you said you wanted to give them money, you were prepared to give them money. Did you verify indeed before you committed to give them money that indeed they do not have the money, and had they spent their USDG grant? That's my question.
Honorable Randall, sorry. Honorable Randall.
Thank you, Chair. MEC, I want to come back to the fire at Bank of Lisbon, because this is a cause of concern, and the arguments that were raised when the researchers posed the questions. And we noted the lack of proper record keeping for evidence that would support your financial statements. And the answer to the researchers was then the department is currently in a process of digitizing the docs to ensure the seamless retrieval when required. Now, you did indeed provide AXA with these reports, but unfortunately there were not enough time for them to audit them. One of the reasons that we got, and I think the members will still remember, I was really shocked that we can be told that, you know what, some officials deleted emails that was containing invoice details and stuff. So we don't know how can we, retrieve this information? And I was still saying, don't they know that emails goes on the cloud, and they mustn't come and tell SCOPA members that, sorry, we lost the evidence because officials deleted emails. I think it's really, it's unacceptable that excuses like that, and I'm only mentioning this one excuse, it doesn't go down well. I will not accept an excuse like that. Thank you.
Honorable Tau.
Thanks, Chair, MEC and colleagues. As I understand it, and maybe the MEC and colleagues will clarify, the issue we're engaged with, of course, is a recurring matter. So you're engaging with a recurring matter, but the genesis of the problem, at least, seems to be that invoices were paid, and therefore the finding is that there is irregularity in relation to the invoices paid. Now, the question becomes against what is the invoice paid. It would be important to get a sense of the process that goes through the decision-making of the payment of a specific invoice. Because as the invoice is received, and you appreciate that the records have burnt down or are no longer available, but against what is the invoice being paid? A related question is in relation to the possible re-establishing of the record, and this relates to if as a starting point, before the invoice is paid, the question to the contractor is, against what am I paying you? Because then the contractor would say, but I have a contract with you. I can't imagine a situation where somebody comes and says, here's an invoice pay, and you say, but I don't have the record against which I'm paying you. But give me the record so that I can be able to clarify that I have this project with you, and therefore the record is recreated for purposes of the department. Wouldn't that have been a solution to the recreation of the record so that, in fact, you are able to resolve this problem, but also able to resolve the impasse with the AG to the extent that the issue is primarily around records and what are the possibilities of recreating that record on the basis of the people that have invoiced us. Thanks.
Thank you. Honorable MEC.
Okay, CFO will still come, but is it Member Randall there? Honorable.
Yes, Honorable Randall.
Yes, Honorable Randall, yeah. No, thanks for the question, and I think that you see, if there are officials who have deleted records, and there is proof, it has never been brought to my attention. Neither have we said that in the response. If there are, I think those officials there must be consequence management. So I agree with you, absolutely. And we would want that information to be brought to our attention. Last year, when I had a chat with the committee, I explained to you the difficulties, how we found the department, the state it was in, and all sorts of corruption-related issues. We even acted, remember, we fired someone without even a hearing. If you remember, someone went to a hearing, fired for irregular expenditure. There's someone striking now as well. We even sought a legal opinion on, can't we expedite this case? So we are, just last week in DID, without digressing, so the HOD calls me, there's someone who works at a hospital, one of our hospitals. They were found with the the cable. They stole the cable. So HOD says, no, we want to suspend this person. I say, well, how do you suspend such a person? You fire that person immediately. Let's deal with the consequences, because unless we get to a point where we don't tolerate certain behavior, we will continue to have this problem. So my posture is that I'm not defending any official, because in the department, I don't spend money. I appropriate on behalf of the department through the legislature process, and then I do oversight. So I have no business defending any official, but I can't be disingenuous as well and pretend as if I don't know what's happening, because on a monthly basis, I've got sessions and interaction with the officials on what is happening. It is for that reason that I'm able to formulate opinion on any matter. And there are matters where I have agreed with the AG previously. In fact, in the 12 years I've been in MEC, most cases I'm on the HOD side, I mean the AG side, because my attitude is that that process of the AG, this process of SCOPA, the process of the legislature helps me and the Executive Council to have a better appreciation, and where there are blind spots, we're able to, they are brought to our attention and we can act on them. So we don't have to see it as a opposition or a destructive and all that. They are helping us. We don't have a problem, and that's why we will not hesitate if there are any matter. So I would agree with you that if there are, and in fact it's strange, as you say, because there is the server of the province, not managed by the department. It's managed by Department of E-Government. So if there's any information that is needed on your official, you don't even need the Department of Human Settlement. You just go to eGov. I think we are one of the few provinces whose server is centralized, and we're able to get that information. Member Tau, on the issues of, I think you are correct, and you are raising critical and fundamental questions, which we have asked. If you pay, against what? But remember, some of these payments were payments that were done 2012, some of them. And at the time, the Bank of Lisbon had not been down. Some of them were done, of course, in that year, 2018. But we will not rule any possibility of deliberate mischief, and because I don't like accusing people of corruption without any basis, unless we find. But we will not rule, you know, at some point, and unfortunately, I can't say this with conviction. At some point, I was even believing that the burning of the building was orchestrated. But I can't say this because I don't have facts, you know, because it's so strange how it has happened, the period at which it happened, the issues that are arising. And some of the companies, by the way, which have been paid are the same companies which have been in the system and milking the system. Firstly, they've been having evergreen contracts. There's a company which, when I got to the department, they were claiming 56 million, and that's for standing time. And this company has been having evergreen contracts. When we came, we were told that our accruals are sitting at 1 billion. After quantifying, they were sitting at 750 million. As we speak, they sit at 66 million. Some of those that were not, because we said to people who claim that we owe them, bring the invoices. At the time, we were said to be owing 1 billion. We spoke to National, because it was during COVID. We spoke to Treasury. We said, can we take 1 billion and pay all our accruals? They said, no problem, because we will not even be able to build and all that. The people who came forward to provide POEs, proof that there was work, it was not even 300 and whatever million. So you can see there's been a systematic, well-coordinated way of doing things, which included evergreen contracts, the payment of variations. One of the things we said when we got there with the HOD, and it appeared like unreasonable, because you can't say that in a built environment, is that no more variations. Because you know what it means? It means as you build, in the event there's a stone there, it means the project might stop. So the variation means that in the event there's a stone, somebody, so we said it can only happen under extreme exceptional circumstances. And we were told that, no, you don't know what you are doing, you don't know what you're talking about, this is the built environment, which is what I've been told now at DID, because I said no more variations, because when you check, that's where the problems are. And what is funny is that all these variations, all of them, they meet the maximum threshold. I'm saying the projects are not the same. How is it possible that all the variations are at the maximum threshold? It means there's a problem. You need to work on it systematic. So, member Tau, I agree with you on the questions that you are raising. We've raised those questions, but there are these issues. We have, however, started the process of re-establishment. In fact, some of the systems are in place already, automating everything. I mean, at some point, just 3 years ago, we had manual payments. And I said, how on earth in Gauteng in 2018, you know, we are still having manual payments. And we said, let's get rid of those. Treasury came to the party, helped us to put the systems in place. But we are not saying we are perfect, and we will continue to. But maybe you want to add, CFO, on 1 or 2 specific issues. Thanks.
Thank you very much, MEC. Good afternoon, honourable members and chair. I just wanted to add.
Maybe you should introduce yourself. Maybe you should introduce yourself because you're speaking for the first time. No, I was asking the CFO to introduce himself because he's speaking for the first time.
Two.
Yes, my apologies, Chair. My name is Abdullah Ismail. I'm the Chief Financial Officer for the department. I just wanted to add to Honourable Member Tau's question about trying to recreate some of the documentation. Chair and members, the challenge with the Capital Works in Progress CWIP is that we recreated the register going as far back as 2012, right up until 2022. It's in essence close to 18,000 invoices that we took off the SAP system to regenerate these invoices. We did make an attempt to contact some of the service providers because the biggest challenge is the actual contracts that AG claims is creating the material misstatement because they can't find a contract linked to the invoice. We made attempts to contact some of the service providers. A lot of them have, most of them, and not, in fact, not all of them, says their documents older than 5 years are destroyed. They don't have it. Some of them don't even exist any longer. And it's become a situation of impracticality because it will cost us more than R1 billion to try and recreate the contracts for these 18,000 invoices, which in essence is actually more fruitless and wasteful expenditure just to try and get an audit issue resolved. So an attempt was made. We tried every form of audit evidence to try and obtain different audit evidence, but unfortunately we were not successful. We still argued the fact that it was impractical. There is sections that allow for impracticality, and it's something we're also looking at, Chair, moving forward. Thank you.
Sorry, Chair, I missed the question from Member Kekan about the USDG and whether we checked if the municipality had money. When I was in Coct, I think that's what the Treasury does. But you know, the difficulty is that national gives us money as provinces and municipalities. So in the main, I think there's 3, at least in the human settlement space. In the main, I think there's 3 grants. The USDG, which goes directly to the municipality, and that's meant for bulk-related works. The HSDG, which is your top structures, because as you know, housing is a competence of both province and national, and then the province can decide to either delegate or not, which we have done previously, and it has not worked well. The next one is the UISP, which is the informal settlements grant. So this informal settlement grant goes to the metros, and then it goes to the province. So the province receives the money for the non-metros. In fact, the money we took to buy that land, we're not supposed to, because we don't have the money for that. So if we were to operate like that and say, no, but the city, you have the grant for this, so we can't intervene, then we'll have a problem. It means if we go, for instance, to Nansfield Hostel, which is here in the city, and there's a problem of flooding, and we should, relocate people. The city says it doesn't have money. I can simply say, no, it's not our responsibility, you have a budget. So you can imagine if we were to have that kind of attitude, we will not move. You know, the K51 residents are also part of this, Mamelodi flood victims, and I think there's quite a few others. Unfortunately, the city is supposed to come to the party on the provision of services, and it's not. So I said to the team, perhaps these informal settlements where they are interim services. So let's relocate them with interim services and immediately start planning for permanent installation of permanent services so that we know how much will that cost. Because where they are, it's not habitable, anything can happen, we have to relocate them. So we know there's the money there, Honorable Member, but remember when it comes, it's already committed. They submit the business plan directly, not through us. And we had said in the last few MINMEX, I don't know why this is not done, that the MECs of human settlement in the province must have a say or be copied in that process. And I think there's another process we could use through the IDP's MEC of COGTA to check if there's that alignment and all that. But it's a challenge. Yeah, thanks.
MEC, in your earlier response, there's a statement you made. I want to be sure if I understood correctly. You said that you per advice, you are, I'm not sure whether I said you are considering or you've already done it, to take the report on review. I'm not sure if I'm summarizing you correct. That's why I'm asking the question. Maybe you should clarify to me about the status of the report. I know you said you submitted because it was required by the, you signed, sorry. This year, the HOT signed because it was required, but then you said other things. Am I summarizing you correctly?
Yes, absolutely, Chair.
Okay. Now, given that, honourable members, there's another question we must answer. The oversight that we are undertaking now should be based on the report that is submitted to the legislature, because we're expected to give a report. But we're confronted with a situation where the report that we are supposed to be doing oversight on is going to be taken on review. What are the implications? Isn't it that later the report might come differently? Okay, maybe I should ask it differently. If, based on the process that the MEC is undertaking, the report comes as it is, then obviously our oversight should be based on that. But if there are changes, what are the implications of the process that you're undertaking now? I'm asking honorable members, MEC, please don't say that you are in a meeting or we're not talking to you, but please, I want to clarify this matter amongst members. It's a pity also you don't have our legal department here. They would have advised us. But let me hear what members have to say. Honorable Tau.
Chair, maybe the question I need to ask before I try and answer your question is whether the report will serve before the legislature when it is undergoing review. If it is, then maybe I'm answering the question already. If it is that it still serves before the legislature, then we should engage with it. But if it is that it is not going to serve before the legislature because it has gone on review, we will need to report to the legislature that this report has gone on review, and therefore if there's not been processed, that would be my sort of idea. Thanks.
Honorable Ncube.
Chairperson, maybe you can get in here. From where I sit, I think I heard the MEC saying they're thinking of taking it for a review. So if they have not, if I heard him well, if they have not yet taken it for review, the report has a standing. so it can serve, because we got it from at the legislature, that's why we're interacting with it. So if they haven't, the report is still authentic in terms of how we received it. And he also said they signed. Thank you.
MEC, I'm sorry to bring you in here. Maybe you can clarify that, because I thought I asked earlier and I thought I understood you, but maybe I misunderstood you. Yeah.
Yeah, we are taking the report for review, but remember, that is a process. So you firstly ask for an opinion to check if there's a basis to take the report on review. On the basis of the opinion we've received, which I said is a provisional opinion, and the opinion is based on the views of a senior counsel and a chartered accountant firm. There are issues, according to the preliminary advice, that we have an issue, or rather, there's a basis. So the process has started because we already have a report. And once we have a report, we must now instruct the senior counsel either to, and I think from where I'm sitting, and I want to suggest that even if we take it for a review, let's rather get an arbitrator that is independent instead of going to court, because it will be costly, lengthy, and all that. And maybe to answer your question, in my opinion, is that the standing of the report is as is until there's a different outcome from that review process, whether by a court or the arbitrator. That's my understanding, because there's not been any outcome of a court process, or if there was an outcome, then it can change the status of the report. Despite the fact that we are not agreeing with it, but its status remains that the department has got unqualified, there's irregular, there's all the issues that the report raises stands, and the legislature obviously has a right to discuss those issues, because remember, in terms of the PFMA, we've got a specific period to submit the annual report. Hence, we had to sign despite the fact that we're not agreeing with it. Yeah.
Honourable members, I'm not sure if I'm jumping the gun. You'll advise me. If the report, I think the MEC is saying there is a decision to take it on review. Would it be a problem if we revisited our discussion last time, that for purposes of SCOPA to be assisted, we request MEC for Finance to engage both the department led by the MEC for Human Settlements, including Housing Fund, and the Office of the AG. Remember, and if you look at the responses we received, there are a number of areas where the department raises that they've engaged the AG, but they still don't agree with the AG. There are a number of areas. So I'm thinking that if we were to help this oversight process that you're undertaking, wouldn't it be better that we go back to the thing we discussed last time when we were discussing the report, and take a decision that we request the MEC for Finance to engage both the department, I don't want to use the word mediation because it's something else, but whatever, but the issue, let the MEC engage, because if in our understanding it would seem, that when it comes to certain policies or certain grants and all that, the department has a certain understanding on how they must be treated in the financial statements. The Office of the AG has a different view. And that's where the problems are. And on the basis of that, I want to hear what you say. So I would think that will help us, so that then, if we agree, then the MEC can be able to come back to us and say, this is where we are, how do we deal with the matters then moving forward? You want to say something, MEC?
Yeah, I
before?
do. I really do. I'm not sure. You want to overburden the MEC of Treasury.
Hello?
Yeah, I'm saying I really do want to say something. You want to overburden the MEC of Treasury. I'm not sure what that means. If you want my colleague to intervene between me and Treasury, I don't know what that means. So that's one issue. Set it aside. The second issue is that when the auditing process is done, Treasury is involved. There's an accountant general in Treasury who speaks on behalf of all of us. If we're not happy, we all go to the accountant general. And then my understanding is that the accountant general will then, with the HOD, team of Treasury, brief the MEC of Treasury. It might not have been this MEC of Treasury, but the MEC of Treasury. The MEC of Human Settlement and Infrastructure has also been briefed. So this is what I'm saying. I don't understand what that means, Chair. You might be creating problems for me and MEC Mamabolo, unintended. So if we suggest that let there be an external arbitrator or working, whatever, and they deal with that process with the officials, and we are not going to be involved, and we are able to get an objective process. The HOD of Treasury will be involved, of course. I mean, she's the custodian of the public purse and all that. So I suggest that process. But if the process you are creating, you will create problems for us. Because you are basically saying my colleague must summon me. That's what you are saying.
Yeah.
Not in deliberate. Thank you.
Yeah, maybe the difficulty is that we are discussing this with you because we are discussing a process of the committee. And that's where the difficulty is, and we are mixing two issues. You've already said the department is going to take a process of getting an independent person. We can't interfere in that process as a committee. It's not our process. And we can't comment whether it's right or wrong. But we are saying for purpose of oversight, what is the best way to handle it? Maybe not to compromise your MEC. Would it be a problem if you allowed us to have this discussion as a committee? We will finish it before 1. Then we'll call you and explain to you what our decision is. Because we have promised you that by 1 o'clock we'll be done. So we'll be able to do that. Just give us 5 minutes.
No, it's fine. What I want to check, I can even leave for that. We don't put the committee under pressure. Are there issues that the committee still wants us to deal with, so that we deal with those issues? And the committee can decide whatever decision it wants to take. I won't be here. And if I disagree with the decision of the committee, I will respond. So it's not a problem. It doesn't have to be communicated now. So I suggest that if there are questions that I must still answer, we answer them, and then we can leave. The committee can decide whether
Yeah, no, we're not under pressure. We're just asking, give us 5 minutes. We will finalize this matter within 5 minutes. Then we'll call you back. You don't have to leave. I promise you, by 1 o'clock, you'll be out of here, as per our letter.
I wanted to know if there are issues.
No, that's part of the whole discussion.
Okay.
Sure, thank you.
No problem.
Thank you. No, you're remaining. Okay, let's close that door, please. You wanted to say something from the HE side?
Thank you, Chairperson. Good afternoon, members. I just wanted to confirm, should we stay or leave?
Oh, okay, no, you should also leave, I think. It's correct. The only person who can say is the MEC for finance. When I say leave, I mean you can, yeah, don't leave like as in. Honorable members, I don't know what your view is. Let's try and be brief and to the point. Honorable Kekana rules, Honorable Ngube, Tau, let's see.
Chair, my view is that we are doing oversight over the department. They are intending to put the report under review. Currently, it's not. And not all areas are under dispute. So I thought, as the oversight committee, we should proceed to do oversight. Where we come on areas where there is a dispute, they will say that this is under dispute and we may not entertain that, we may not go deep into that. But if AG can respond to that in our presence, so be it. So I think we should proceed with doing our oversight until, the process is completed, because the MEC has signed it off. They've accepted the outcome, even though they are intending to put it under review.
Honorable Ngube.
Thanks, Honorable Chairperson. I would also say we received a report in a manner that all other reports have been received by other portfolios. And the department has signed, sanctioning that legislature must receive this, and committees must then look into them. Where they are differing, he said they are not happy about the things that the AG have found dating back from 2012. However, they signed, sanctioning to say, let it be discussed by ourselves and the portfolio. So it is an authentic report. So outside ourselves, that process, which they haven't, it has not gone to court. If there's a finding from the court, then we'll be saying, no, let's do whatever according to what the court is saying. And then on the mediation by the Treasury, I will agree with the MEC for Human Settlement that if the Treasury, the former MEC of Treasury was involved, and then whatever discussions were there, but there is an agreement. And then whatever, this process that he has indicated, that it has gone through them, even if it is not this MEC. So the mediation now, it cannot work because already there was an involvement of the Treasury prior to the current one. Thank you.
Honorable Tau.
Thanks, Chair. So the MEC for Finance is the head of the Provincial Treasury in terms of the PFMA. And the roles are prescribed in Chapter 3 of the PFMA as to what Treasury and the MEC as head of the Provincial Treasury can do. So what we are requesting the Provincial Treasury to do is their job. So we're asking them to do their job, which is there is a matter related to standards and reporting. In terms of Chapter 3, you have a duty to intervene by taking appropriate steps, which may include withholding of funds to address serious or persistent material breach. But this is not about, no, I'm reading the wrong section. But the point is, and I'll come back to the actual section, is that it is the provincial treasurer's responsibility to ensure oversight of overall reporting and standards in the province. And therefore, what is being requested by the committee is within the mandate of Treasury. And all the committee is saying is, please intervene, Treasury, to ensure that this impasse is resolved. And maybe even asking it as a mediation is an arbitration is fairly mild. Maybe we should ask Treasury to do its job and exercise oversight over this process. Thanks.
Thank you very much. I think you've, what you call it, hit the what on the nail, because I think it's the use of words, phrases, mediation, what. That's not those. That's why I was trying to avoid those words. I use the word engagement. So I think that let's agree as follows, honourable members, that we will ask Treasury to do its job. I'm using Honourable Tau's. We'll even try and get the proper legal thing, right, to both MECs, and also that, you see, some of these things are administrative, but there are political heads who must take responsibilities. So we'll take it within that context. Lastly, is that because of time, we might not be able to continue engaging the department on other things. So let's agree that we'll still call them next year, because this is our last meeting anyway. We'll call them next year on maybe another public hearing, but in the meantime, we'll follow this route. Agreed? Okay. Honourable Tilang.
Chair, thank you very much. I suppose that is where we are. It's just a pity that we do not finish with the department, because it's one of our concerns, areas of concern, big concern. It's this particular department. I also do want to make the remark that it's also a pity that they did not let us know beforehand, after they have signed off the report, before they came to us, that they are turning around and they are disputing some issues. I mean, they were supposed to let us know beforehand so that we can properly prepare, which they didn't do.
Okay, I want us to, I said we'll finish at 1. I want us to ask them to come back so that you can just explain to them about the postponement of the public hearings. That's all we are going to inform them about. Because there are other things here. So if they can come back, and then after that we'll break for lunch and come back for the other one, which has to do with the roads and transport and what is that? G-Fleet. Okay, let me see. I don't think that we could wait for all others. I think now that you're here, we want to. Yes, there are a number of issues we still want to have a discussion with you, as it relates to the report. We took a long time discussing the first issue. So what we recommend, what we've resolved as a committee is that because of time, we will, this is our last meeting as a committee. We will also engage you next year to take up or engage you further on some of the things that we wanted to ask you. So, yeah, and then, yeah, in that regard, we hope that all other things that we are raising would have moved on them or not moved, whatever, but it's not dependent on that. We will be able to engage on other things next year when we resume our work. That's it. Thank you very much, MEC, for your time. Let's break for lunch. We will be back at 2, although we have said the next public hearing starts at 2:30. Thank you very much. did you send us the roads and transport one also? Remember we had the questions last time, so did you send them to us now? Huh? Okay, please do. So, honourable members, thank you very much. So there are two things. We are dealing with roads and transport and also G-Fleet. Now, as you'll remember, we did have an assessment or analysis on roads and transport. We did generate follow-up questions, which is what we're going to use for this session. But we didn't do G-Fleet. So what we suggest to do is that we will ask them to make the presentation on G-Fleet. Then we'll engage with the presentation. But we'll start with roads and transport and finish it, then we go to G-Fleet. So if they've sent the presentation, may it be ready. But for now, that's how we're going to handle it. So we will ask, like if the first question is asked by, so we'll just go like that. Yeah, sure. It makes things easier for, yeah, because there are people's names, but remember some of them are not here, so we can't have that. Okay, shall we have the department? Are they here already or not? HOD is, oh, okay. Okay, thank you very much, MEC, welcome. Let me just indicate that in our midst, we've got members of the Standing Committee on Public Accounts who are sitting in front here. Then we've also invited chairpersons or members of MPEX from the municipalities in Gauteng, because we work with them, so they are also here. We also have okay, I think they are no longer here, but we also have Treasury, Gauteng Provincial Treasury, they always assist us in this process because of one of their mandate. The rest of the others are staff members of the committee. So you are welcome. I know that is the first time you appear before SCOPA. So I'm not sure if you've got any opening remarks you want to make. Let me just indicate that we are not going to have introduction of your officials to save time. They'll introduce themselves only when they speak for the first time. So those that won't be able to make comments today, we might end up not knowing them. So over to you, MEC.
Thank you very much, Chair. I was running in the car and I ran to arrive in this venue, so I choked because it's immediately after having lunch. And thank you very much. And our apologies to the portfolio committee. I think we need to formally apologize to not showing up the last time. Though the team was ready to come make presentation, it's just that the office of the MEC had thought that it's not compulsory to be here, especially because we didn't get the invite on time, and between the legislature and our office, there was challenges of understanding there's new officials in the office of the MEC. So thank you very much, Chair. I think I'm not going to also waste time, considering that I'm trying to settle and hand over to the team to make presentation they are supposed to be making to the committee. And good afternoon to honorable members. Thank you very much.
Okay, thank you very much. The apology is accepted, but also you want to apologize for the misunderstanding on the reorganization in your office. I'm glad that that has now been resolved. We are not going to receive, okay, you are discussing two reports, MEC. One is Gauteng Provincial, Gauteng Roads and Transport, Department of Roads and Transport. We have gone through that report. We've identified areas where we want to make follow-up questions. So we're going to be asking you questions with regard to that report. The second one, which is the department, the G Fleet, we'll ask that your team be ready to make the presentation on that one. So we'll ask questions, members will ask questions, and then we'll expect response. We know that when we ask questions to you, but you can delegate to any of the officials to respond to the questions. Thank you very much. Honorable Kanyane.
No, thank you very much, Chair. And also MEC, HOD. Yeah, the first question, it came to our attention, MEC, that you are not drafting policies on your own. Instead, you are getting assistance from service providers. Now, as the committee, we just want to find out, is there really a problem in terms of capacity from within? Because it's more of outsourcing. That's the first question. And the second question, also it came to our attention based on the report that you don't have proper record keeping. Maybe if you can share with us corrective measures that we've really put in place to remedy the situation. Now, the last few questions.
Maybe, Honorable Kanyane, let's deal with those because, yeah. And I think the first one relates to provisions. That the first question that he asked about policies. The second one is really about the department revenue, when he asked the question about record keeping. Over to you, MEC.
Thanks, Chair. Let me request the HOD to lead the team in responding to the questions, and if they are not responded to adequately, I'll try to make my additions. And I think these are old questions, but we'll take the portfolio committee into confidence on what is it that we are doing with the challenges that have been there in the department. Thank you.
Good afternoon, Chairperson, and good afternoon, members. Chairperson, my name is Darren Barkley. I am the HOD in the department. Chairperson, in relation to the very first question when it comes to policies, Chair, I think we must just distinguish between internal policies and external policies. Internal policies that is governance related, that relates to the work of the department, those policies are developed internally. There is a governance unit that forms part of legal. There is a smaller policy unit that comprises of a director that also deals with IGR. So from an internal perspective, those governance policies are dealt with internally. There is also a section that deals with the secretariat services in the office of the HOD that deals with all the committees and the functioning of the committees and the charters to ensure that there's governance structures in place. What you do have, Chair, in this is where the external service providers are coming in. You do have a transport planning section, and that particular transport planning section is dealing with transversal policies. Engineering related, there's design related, there is policies in roads, and of course we have assisted and been supported by the CSIR when it comes to that. It has not been for a period that is endless. It is a period that has a specific time frame to it. What we would do on an annual basis, we would identify what the need is based on the annual performance plan, and then we will decide what policies do we need. We obviously then decide, you wouldn't execute all the background work, or should I say, you wouldn't outsource everything to the service provider. There is, of course, work that needs to be done internally. There is benchmarking that needs to be done internally. But of course, the policy needs to be informed by the broader policy framework that is both transport related, that's roads related, that cuts across both municipalities, national and provincial government. So of course, on that basis, you would need like research capability, particularly in the CSIR, that would support us. But from an internal perspective, Chair, it's something that we dealt with. Obviously, going forward, we plan to reduce our reliance on the CSIR and also on consultants and limit the work that they would be doing for us as we gradually capacitate the organization with some of those skills that has been eroded in the department. So Chairperson, that is when it comes to the drafting of policies. Chair, let me go on to the part that deals with proper record keeping. And Chair, I have indicated, I think I appeared before the committee on the 31st of May, if memory serves me correct. And I have indicated that we have embarked on a digitalization process where we are digitalization of all records. These records, we had to identify what would be the key risks. Supply chain has been identified as a risk, and human resources has also been identified as a risk, because when the AG comes into the department, you ask for new appointments, resignations, transfers, secondments, and then from a supply chain perspective, they ask for all the tenders and they decide which sample to use. So it's the information that you have is voluminous, so there is a need for us to expedite that. That process is still underway. We plan to complete, I think, almost 50% of it by the end of March, and then we will be going through other units. Chair, there is also a process where units have essentially kept filing documentation in their own units. So whilst you have a central registry, they have not kept all the documentation in the registry. So we have also started a process that units needs to be ensuring that whilst they want to keep a set of copies in their own units for record purposes, all the information should go into a central repository to make sure that you have easy access. We also note that the issue of the status of records review is something that the AG have raised, and taking into consideration the findings that the AG have raised, we have addressed some of those concerns. But we are not at a level of maturity yet at this stage, Chair. I still believe that the number of documentation that we have in the department, determination as to what should be archived, what should be kept in the department, some of those key decisions still needs to be made. Of course, when you look at the audit process, there will be times when you need to go back into a previous year's audit. So you would not want to archive all the documentation. So it's important for us to deal with it like that. But the process of record keeping is something that we know the potential risks that the AG have identified, and in line with that, we believe that the mitigation measures that we have implemented will assist, although I believe that we could have some challenges, but not to the extent that we had in the past. I believe that we are on the right track. Chair, when it comes to the issue of provisions in revenue, I think the CFO will provide the details further. The issue of the provisions is one of the parts where the AG had a challenge with us. And I think for us, it is merely that in the past, that particular areas was regarded as immaterial. And at this stage, the AG has audited that.
Maybe let me clarify. I think because there are specific questions we're asking. What I was trying, when I said provisions, I was saying the question that Honorable Kanyana was asking about policies relates to the finding on provisions, because in your response, you then indicated that you are getting people outside drafting policies for you. So I'm trying to explain that provisions was related to the first question, and then departmental revenue was related to the second question. So if you ask them, if you want them to respond, let them respond, but I thought I should just clarify that.
Okay, I think let me stop there, and I think let me get the CFO to respond to the others.
Okay. So basically, CFO is on provisions. We just want to find out why you're going out to draft for policies, because your responses indicated that. But on departmental revenue, we also want to find out, like Honorable Kanyane has indicated, that you are not keeping proper record. What's the problem?
Thank you, Chair, and good afternoon. On the issue of provisions for retentions, the policy, we have it in draft internally. We are not actually getting the assistance of service providers. As the HOD has indicated, we do get assistance of service providers on other policies that we consider rather complex for the department. But in the case of provisions, that policy, we have it developed internally. It is due for actually approval, even in terms of addressing the issues that were raised by the AG around the provision for retentions. We have actually already addressed that. We're just waiting for our internal audit and Auditor at General to actually come in January to do the audit around the remedial actions that we have put in place. And with regard to the departmental revenue, once again, the issue, as the HOD has indicated around provisions, what was the key issue was that, as you would have realized, what was the issue for AG is not the whole revenue. It was just part of the 62 million, and mainly the issue was just around the fact that in the past, AG has regarded that part as rather immaterial, has not really looked into it, and when the department submitted the information to AG, it submitted information in accordance to what was submitted previously and was never queried. We do, however, had an understanding with AG. We have actually put in place, address the issues that AG has raised, and mainly it was around the record keeping. We actually are satisfied with the milestones that we have achieved in terms of record keeping. Thank you.
Thank you very much. Any follow-up questions, honorable members? None. Okay, let's do this. Honorable Kanyana, you can ask the next question, but only the question number 3. Then Honorable Randa will ask question number 4, then Kekane number 5. Honorable.
No, thank you very much. I think as a sequel to the issue of the proper record keeping, I just want to find out, to say to what extent that lack of proper record keeping impact on the issue of litigations and contracts. That's one. But now the other question will be on the internal audit, to say, does the internal audit have capacity to cover things that the AG does not cover? And maybe lastly, what measures does the CFO and the accounting officer have in place to audit the department if they do not have internal auditors, to ensure that they follow regulations and prescripts? So those are the three questions from my side.
Over to you, MEC.
Chairperson, thank you very much.
I was expecting that the MEC will say
okay.
You can respond because.
Thank you very much, Honorable Chair of SCOPA. I'm going to request that the HOD for Roads and Transport respond to the question as raised by Honorable Member.
Thank you.
Chair, thank you very much. Chairperson, the issue of record keeping, if you look at all the current cases that's coming to the department, if you look at current issues relating to portfolio of evidence to support our performance in preparation for the AG, I'm comfortable that we have the necessary systems in place. Chair, but we must be open. If you look at our litigation book, it is a litigation book with legacy contracts. And that is where our problem lies. And this is where we cannot deal effectively with cases. We've often been asked by the Office of the Premier, why are we not closing some of the cases? Luckily, on the one hand for us, these contractors have not taken matters forward. Some of the matters are dormant, and we need to find a way where the State Attorney represented us, that we ask the State Attorney they must move to close the matter. But Chair, I think it's common cause. We struggle with that. And often we need to go and dig deep for information. So when it comes to legacy contracts, I believe there's a problem, and we need to look at it. Chair, at this stage, then, when we look at current processes, let's take the most complicated process in the department when it comes to a tender. I don't know how the process in the past have worked, but what we have agreed and what the standard operating procedure is now. When the tender is advertised, the accounting officer approves the appointment of a bid evaluation committee and a bid adjudication committee. The bid specifications committee, of course, has been approved in advance already before the tender goes out. The bid evaluation committee convenes, they keep minutes of each set of meetings that they have. That goes into the bid adjudication committee with all the tenders that they consider. Once the bid adjudication committee makes a recommendation to the accounting officer and the probity audit has been done, at that point in time, once the accounting officer approves, I will not enter into a contract or issue the letter unless the contract has been verified by legal and together with the bid adjudication committee resolutions and all supporting documentation, it is then signed off. By the time I sign off the contract, it is then handed over, so the person must submit all the guarantees, and that is the value chain of how we're dealing with current issues relating to record keeping, in particular where there has been challenges. So I do not foresee current challenges. I know the AG raised an issue in the past, and that was the only issue, Chair, when it comes to record keeping and a tender that they have raised on K46. And it's only because that particular contract was over multiple years. There was different contractors, and we had different problems with the different contractors, even to the extent where some of these contracts has been terminated. So I think the standard operating procedure, I believe it's working well. Chair, when it comes to internal audit, as a department, we do have very minimal capacity. That particular function of internal audit, it's primarily performed by the Gauteng Audit Services. In our risk management section in the department, you do have a chief risk officer that's supported by risk management teams that also has an internal audit background. What we do, Chair, is on the one hand, you have the performance information that goes through a rigorous verification process. And if you look at our audit results, there were not even minor findings under performance information, not to mention major findings. So that area was completely clean. When it comes to the recommendations from the AG and the recommendation from the Gauteng Audit Services, it goes through a verification process through the Chief Risk Officer's office. And only when it has been verified and accepted, only then those findings are closed. Because in the end, Chair, the biggest problem is, are you looking at the finding, or are you also making sure that the root cause is addressed? The root causes needs to be addressed, otherwise you close the finding, but if you don't address the root cause, it will just re-emerge in the next section. So we believe, Chair, we have started a process to bring in a few more graduates under the risk management area. We have also recently appointed some staff in the risk management area to make sure that the internal controls are robust enough, and particularly they test the controls, particularly under supply chain, the work that the property auditors are doing, so that we do not have any findings insofar as that is concerned. That would be the response insofar as that is concerned, Chair. Thanks.
Thank you. Any follow-up questions? None. Honorable Randall, and then after that, Honorable Ketan.
Thank you so much. I'm going to ask my question on the capital works in progress, and specifically mentioning the 2017 utilization of the electronic document management system. One would want to know how far have you progressed with digitization of the documents to ensure seamless retrieval when it's required? And was this system previously put in place effective? Or has this project never materialized? I know you've alluded to, HOD have alluded to the engagement we had with you in May this year. And the answer when we asked this question is that you would indicate by the end of September where the department was. And so just the current status of digitization, Chair, and I would also then want to throw in the asset register in terms of digitization. You said it was done by consultants. How has the department progressed in terms of a system there to retrieve the documents? Thank you.
Over to you, MEC.
I'll request the HOD to respond.
Chair, thank you very much. Chair, based on my response on the 31st of May, I think we can safely conclude that we have not exercised proper monitoring when it comes to the electronic document management system, because we would have had all the issues addressed when it comes to documentation. If you could look at the AG's report, we agree that the turnaround time for documentation is 3 days, and there is times when the department is taking longer. And as soon as the department is taking longer, then we must acknowledge that there's a problem with the document management system. Chair, with the information and the voluminous information in supply chain and HR, we are making good progress. I was hoping by the time we would get to end of December, I would say we are at about 75% done. We are not at 75% done. We have focused on the current year, because the current year would be the year that will be audited. Of course, some of the issues raised by the AG in the previous year, particularly to contracts, capital programs, we're also looking at that. So if they want to go back, because the AG would first look at the findings that they have raised, they would ask for supporting documentation, and we'll make sure that those areas are addressed. Chair, when it comes to the asset register, the CFO can also provide some further detail. I think as a department, we just have a very complex process when it comes to assets. If you look at any other department, you look at the assets that the department has, desk, chairs, computers, printers, that's the assets of the department. The department do not count for property because the property is vested with the Department of Infrastructure Development. However, in the department, whilst we did not have major issues when it comes to asset management, we did have issues when it comes to our road asset management. Because what you have there, that is also part of the legacy issue. So the AG has just picked up a few roads, and it is some of those legacy roads, school roads that we have assisted the Department of Education with, and they say, okay, where is your proclamation? Where is this? Where? If you don't own the road, can we just clean up the asset register? And that is my discussion and my directive to the team. Can we just clean up? If we don't own the road, if we don't have any proclamation for the road that it belongs to us, can we just take it out? Where we had a gentleman's agreement with education to assist with school roads, it's an agreement, it does not belong to us, it belongs to the municipality. Take it out because it creates audit findings. So that's where we are when it comes to the road asset management system, which has been a challenge in the audit. CFO, I don't know if you want to raise anything about the assets.
Thank you. I think just to add on to what the HOD has said is that-
CFO, what is the possibility of moving that mic like to be, yeah, because when you look at me, then you lose your voice. I know that I'm not that handsome, so, yeah.
Thank you very much. I just need to indicate also that that process we're busy with it of cleaning the asset register. We're working very closely with Provincial Treasury, also because we are migrating from the traditional system that we've been using for assets to another system, and that progress is actually going well. We believe that in the fourth quarter that we will be having audit performed on the work that has been done to clean up the asset register and ensure that actually the migration as well it's actually progressing well. Thank you.
Thank you. Any follow-up questions? None. Thank you very much. Honorable Kekane. Okay, before that, Honorable Tau, follow-up question.
Thanks, Chair, MEC, and colleagues. Yes. And I know it's a legacy issue, so that's not the problem. But I just need to understand from my own understanding. So you say that, in fact, the department has invested in assets which were not capitalized at any point. So there's no body that actually literally owns the asset, because that, in essence, is what it suggests. And it's reflecting on your books, and you want to remove it from your books and put the asset where? So, I mean, it's a road. So the road reflects, so maybe my initial question was wrong. The road reflects on your books, but you actually, or you spend money for the road. Who recognizes the asset and owns the asset? And it's a government-wide problem. It's not a department-specific issue. I can't understand that you would have capital assets in Gauteng, so you have roads and nobody maintains them, because if nobody owns it, nobody maintains it. Or am I missing something?
MEC?
Chair, let's allow the HOD for Roads and Transport to respond.
Let's put on the mic, please.
Okay, thank you. Sorry, Chair. Chair, you know what? There is no right or wrong answer. None of these roads that was raised by the AG was recorded in the last even 3 or 4 financial years. It's years ago that, firstly, Chair, currently, let's take the example. We are working in Sedibeng, Mfuleni, we are working on municipal roads where we use the Section 156 intervention to support municipalities. We have worked on the road, but we don't own the road. So the same would be if the Department of Education would ask us to assist with roads around the school, the municipality that's responsible, if we implement an intervention, we can support. But the issue is, if I can't have any documentation that we own that road, why would we keep that road on our books? Unless we need to go and dig deeper, if it's really our road. But looking at the roads in question where there was a finding, those are not roads that you have any documentation for. And it's roads that's in municipal space. It's not even a main road where you could say it's a provincial road. So it's some of the decisions that we'll have to take drastically. But yeah, Chair, it's not a right or wrong answer, Member Tau, but it's legacy issues, how these roads get onto our books.
So I think if, yeah. So it's possible that the road was built by a municipality, but then because you had to do some work, you then, just because you're doing some work, just because we're doing some work, then it ended up in your books. Is that our understanding? And that's why now you are saying, let's go back and see, this is not our road, so it must be off our books. I want to be sure if that's what. We understand that there are legacy issues, but what's the rationale here?
Yeah, I think let the team respond. Is the CFO that's responsible for the assets? Let me check who's here. Let me hear. But Chair, ordinarily, you would not keep a road on your books that it does not own. And if you work on a road which does not belong to you, the AG would ask you, why would you work on a road that you don't own? You would then issue the memo to say there was a provincial intervention. It's not an intervention where the province took over, but where we provide support to the municipalities through COCTA. And that's how you would justify some of the expenditure. But yeah, CFO?
Thank you, HOD. I think just to respond to the first part, it is not roads that accidentally landed up in our asset register. Maybe just to give a bit of context, how these roads ended up in our asset register is that these are roads that belong to Department of Education, and that was before the restructuring, maybe pre-1994, government. And these roads, most of them, they are school roads. They were maintained by the Department of Education. But then when there were changes in government, those roads, all of them, when Department of Education was then centralized, they could no longer, then they took those roads, all of them, that batch, and they handed them to Department of Transport to say, in the interim, while a permanent solution is being sought, continue to maintain these roads. However, since that time, there's no evidence from our side that there was follow-up in terms of actually coming up with a solution, either of transferring those roads from the Department of Transport to municipalities, because as the HOD has alluded, they actually do not form part of provincial roads. Now, we're not actually just taking them out of the asset register. What we are doing, we're having engagements with the municipalities to actually have those roads, where those roads will naturally belong into the space of the municipalities. We are having engagements to transfer those roads to the municipalities. So it's not like those roads will be out of our asset register and will then be lost. We're having engagements with the different municipalities that are involved so that those roads can be transferred properly into the jurisdictions where they're supposed to belong. Thank you.
Thank you, Honorable Kekane. Then Honorable Atkinson is going to ask the next question after Kekane.
Thank you very much, Chairperson, and good afternoon to the MEC and the team. My question will talk to the material uncertainties related to the contingent liabilities. Chair, when we dealt with the contingent liabilities in the previous financial year, the department referred to a turnaround strategy, which were to be undertaken by the legal unit. So we would want the department to provide clarity to this committee on why the turnaround strategy that the legal unit embarked on in the previous financial year has not been effective, as we have seen that the litigations have not actually decreased. And does the department have the capacity to make provisions for litigations, noting that the litigations are part and parcel of the kind of work you are doing and you are engaged with? And thirdly, how effective is the turnaround strategy if already it has been implemented? Is there a policy in place to deal with litigations regarding the maintenance of roads which should assist with the mitigation of lawsuits? And finally, in cases where maintenance of roads is outsourced, who then is responsible for litigations stemming from the road-related claims? I will pause there, Chair.
Thank you, MEC.
Thanks, Chair, for the question. I think the team led by the HOD will respond. I'll respond in the next meeting.
Yeah, no, it's understandable, let me see. Very understandable.
Chair, thank you very much. Chair, this is one area where I believe that you do so much work, you close so much cases, only to find at the end of the month you are receiving another 35 or 40 cases. Over the last 6 months, we have closed on average about 10 cases per month. There was a time where we have closed about 35 cases. Only to notice that at the end of the month, you have another 40 low-line cases that came as a result of potholes. So the work that you are doing is obviously eroded as a result of all the continuous claims. And remember, all the users, whenever they have an opportunity, they would claim. Whether that claim is legitimate or not, they claim. And once they claim, it has to be reflected on our books. Chair, we believe that the litigation strategy that we are following with the Office of the Premier, looking at mediation, looking at the prospects of success, and where we believe as a department we are at the wrong, we need to negotiate and settle. Of course, the principle of settlement is to ensure that it's far below the cost that you would have gone to court on. And that is the biggest problem. And the reason why that has exacerbated over the last 2 years, Chair, is because of the road maintenance contracts that have expired in the previous cycle, and we have undertaken an extensive process to appoint your road maintenance contractors. And once these road maintenance contractors has now been appointed, and the contracts have been duly signed by myself. So now that they have been allocated to different roads to support the various road maintenance initiatives, the liability will then automatically fall onto the service provider. So once they have literally come fully on board, they've started working, of course, from day one, you will have to find a way, and the legal team will have to come up with an approach. At what point do we hand over the liability for a claim to that service provider? Because if they start on day one, we know that there is a backlog when it comes to maintenance. At what point do we hand it over? But once those have been properly institutionalized, there should be less challenges when it comes to that, Chair. But Chair, our major focus on litigation is currently, as you have contractual disputes, we try to deal with that expeditiously. Because if you don't, it affects service delivery on a road. Except in a case where you have a formal interdict against the department. But where the department have advertised the tender, I have signed off the appointment. If I receive a request from a losing bidder that we need to stop the road because you will issue us with an interdict through court, if there is no material difference in the property auditor's report that indicates the processes that was followed, how the evaluation was conducted, we oppose that interdict and we continue with the road. However, if there is material differences, you have to stop the process because that will become a risk for you. So that's the principal decision that we have taken, Chair, and we believe that process is working well. But I think the biggest headache for me is what you have on your books, that's old cases. When it comes to the new ones, we deal with it expeditiously. And we must just accept that on the one particular road, we have just made a mistake. We should have just defended the interdict on K148, which is the Tambo Springs. Instead, we waited and we have decided to take the matter on review. So to take a matter on review takes you at least 18 months. At least. It's not even 18 months. That's provided that all the parties file their papers in time. But if a person provides you with a notice of intention to interdict and you have all your facts in place, you oppose that interdict and you continue. You only stop until you have a court order. But I believe, Chair, that process is working well. I don't think we will ever have sufficient capacity to deal with legal, just because of the number of issues. You have labor relations matters on the one end, and you have legal. Of course, we use the work of the state attorney to assist us as well, but with the number of cases that you have, you just need to pay particular attention to that. We have recently finalized the interview process, I think, for 2 or 3 senior legal admin officers that would assist with litigation, but then also cases. But I believe, Chair, as we're moving ahead, we should further build the capacity in legal. Thank you, Chair.
Thank you. Any follow-up questions? Honorable Tau and Honorable Tilange.
Thanks, Chair. The HOD is a bit more optimistic than me, but I doubt that you would ever enter into a contract with into a maintenance contract that shifts the liability to the contract, because that assumes that we have allocated enough money in the contract to ensure that no road has potholes. Now, I think that's extremely presumptuous. And unless you're able to say, well, we will have enough money that no road, it's an issue of the contractor, it's not an issue of money. But if there's an issue of money, then that argument cannot suffice. And we cannot argue that, in fact, that's the solution to the problem. That's my perspective, unless you're able to demonstrate that, in fact, you will have enough money, and notwithstanding that you still have a few other kilometers of roads in the e-tolls to maintain. So I don't want us to live here on the basis of an understanding that actually will not materialize, because then we're kicking the can down the road. And I'd rather you give us an answer that resolves the issue or indicates what the risks are, so that we don't just simply kick the can down the road and 2 years down the line, MEC, the contracts have been signed, we still have litigation, and we have to come back to a committee and say, 2 years ago we asked you this question, and I'm not sure that it's a viable thing to do. So that's the first point. The second is a treatment issue, and maybe the CFO can comment. And I mean, I'm thinking aloud, really, to say, should you deal with it as a contingent liability, or can you possibly investigate a self-insurance scheme which enables you to treat the payments differently and mitigate the sort of problems that you have with the HE? Because I can't see you finding any other solution. And I'm presenting self-insurance as but one solution. I'm sure there are other possible solutions, but I suspect that the treatment could be a solution. And it depends on what sort of mechanisms you put in place to deal with it. Thanks.
Thank you, Honorable Tilange.
Chair, thank you very much. MEC and HOD, I must admit I'm not as positive as you are either. I think we must realize that we're not going to win this fight with the potholes, not as long as we get the kind of rain with the changing seasons that we have now. We're not going to win the war with potholes as long as we have the amounts of traffic every day continuously growing. We are not going to win the war with potholes on the roads and the conditions of the roads as long as we have growing numbers of trucks using the roads with our railway network that was completely incapacitated. And I think unless we go that route, we are now getting to a stage where we actually have to budget to waste taxpayers' money to pay litigations. I mean, that is not a solution. It's really not a solution, and I would rather see this department getting to a stage where they say, all right, no, we need to get the railways, or at least go and fight it at national, or get the correct departments involved. We have to go and address that. And we cannot bring the toll roads back in Gauteng, please. That is absolutely a no-no. That's another war that we do not want to enter into. To get the people in Gauteng and people going through Gauteng that spend their money in our economy, to put them under that pressure as well. But at least, Chair, we have to go back and look at the root of the cause of the problems. And that is we have too many trucks on the roads. And our maintenance is too slow. We've attended recently with member Mamabolu where they were fixing roads throughout. It was fabulous to see the people, and they work very hard, and they're very attentive to the work they do and make sure that they do it properly, which is really nice to go back to the people to say, there it is, there's the photos and the videos we took, the people are busy fixing the roads. But I know for a fact, come the next rain, it's gone again, and it is. I've got so many complaints back again. I don't even want to post them on our group because it's just, I know they're busy at other places now. You know the road between Western Area and Randfontein, Rand West, as a whole. That is a disaster. It's a disaster, and when there's an accident, they're going to turn around and they're going to have another litigation against the department. So we have to go back and address these issues, Chair, like I say, otherwise the department's really just budgeting to waste taxpayers' money and not being as effective as they should be. Thank you.
Yeah, Honorable Tilang, I hope you are not saying that Honorable was saying was bring back toll road. That's not what you are saying. You was just saying in addition, the department has to manage.
Yeah, no, it's somewhat tongue in the cheek as well, Chair. Thank you.
Okay, before that, there's Honorable Kekana.
Yes, Chair, in closing my question, especially the second part that I raised, when the AG made their presentation here, when he talked about the department not having the capacity to make provisions for contingent liabilities, I sort of got a sense that he was also talking about monetary provision to say, do you have a set aside that you put aside, knowing that you can't budget for litigation, but you know that litigations are a reality of the situation. Do you have, like, maybe I can call it a slush fund, that you set aside a certain amount to say this will assist in cases of litigations? Is it the practice, or did I get it wrong, Chair? Can you just clarify, HOD?
Thank you. Over to MEC or HOD.
Thanks, Chair. I think maybe one should make the following reflections, and out of the 6 weeks, 7 weeks that we've been there, on our experience and what we are dealing with. And I think also just before we came here, we were with a meeting with MMCs in municipalities. And the fact of the matter is, and I don't know whether it's allowed in SCOPA to raise some of the issues, I think we're at a point where we need to test whether DDM is implementable. And this is, maybe our focus area should be on infrastructure development in our province. I'm raising this because you fix a pothole today, and tomorrow, when it rains heavily, tomorrow the same pothole is still there. And I asked the question, why is it the case? And the department, in responding to this question, in some instances, is because of inadequate bulk infrastructure, aging bulk infrastructure in different municipalities, and as a result, for instance, like in Citybeng, we have a challenge of the sewer system. So no matter what we can do as a department to maintain and develop the roads there, the problem will still persist. We'll still have roads being washed away because of the sewer system there. And I think, and I said, challenging the team, that perhaps we should put a position paper in place that what needs to be done first before we can start talking about maintaining roads and constructing roads in our province. And one of the critical things that needs to be fixed is the bulk infrastructure in different municipalities. And that is not our role as a department. And I think one of the proposals we'll put towards in the Gauteng Provincial Government Exco is to look into what comes first as we speak development in our province, so that we avoid the wastage. I mean, I just referred to road maintenance funds, to what we have been doing as this government, to the sinkholes in Gauteng, where budgets were set aside to rehabilitate sinkholes that are still sinkholes and are bigger than then when money was spent on rehabilitating them. And I think also on road infrastructure, we need to look into what comes first, what needs to be fixed before we can speak to fixing the roads. I think just to respond to what Honorable Kekana is raising, I think we also got very concerned that we are not the only department that deals with infrastructure development, but we are highly litigated. And I think we need to develop strategies and put preventative strategies in place to ensure that we don't, I see in the portfolio committees, it seems it was presented that we are going to come up with a litigation strategy. And I think what we need to do from our side is to ensure whether it's there and whether it's implemented or followed through. And I think we will try, Chair, when we come back next time, we'll be coming very well informed and try to make sure that we have committed ourselves to be doing as a department, we do and appraise the portfolio committee in that regard. I think I want to agree with some of the ideas shared by the portfolio committee and the honorable members on some of the solutions that can assist us to be sustainable as a department in moving forward. So I'm going to ask the HOD to respond to if we have the set aside contingency fund as part of mitigating the litigation risks that we have. Thank you very much.
Okay. Chair, thank you very much to the MEC. Chair, we do not budget for legal services and for litigation costs. Of course, you cannot use any of the other funds in the department, whether it is the national conditional grant, whether it's the provincial road maintenance, that is specifically for that purpose, so you can't use it for any other purpose. So you need to find funds from your operational budget to carry that costs if that happens. But the CFO can also talk about how do they ring fence or look at the budget to accommodate that. Chair, you know what, when it comes to road maintenance, I think the root cause on the one end that contributed to the increased amount of cases is, of course, the root cause, which is the lack of proper road maintenance. The demand just outweighs the supply. And as a department, whilst we have our regional offices, we have not continuously people retiring. Remember, road workers, if you look at them, they've been there in the department for years because that's what they do. So when people retire, when they pass on, we have not really brought in the same amount of people to actually augment that capacity. We have actually allowed that sort of capacity to be eroded. So hence, on the one hand, you need to bring and augment the current internal capacity with external capacity. Chair, I am optimistic about this litigation of the roads. It's something that we're going to test. We'll probably come back with some answers at a later stage to say, we have appointed them at that time. This was the number of cases we received in the past. This is how we picked up, it has dropped. We'll probably come back with a scientific analysis. But, Chair, I fully agree with the member that the Gauteng strategy, which is devolution from road to rail, needs to be expedited. The various role players needs to come on board. It makes me think about a meeting that we had with the EXCO and Ford. Ford was saying the number of vehicles that they're going to manufacture that needs to be exported. They cannot use the road system. How many trucks do you need on the road to transfer so many vehicles from here to KZN, for instance? What about the Gauteng Eastern Cape Rapid Rail Corridor? Those are some of the discussions, and I think Ford has made it clear with the discussions with Transnet that if we don't bring rail back, it's going to cause a problem for investment in the country. And I'm happy to say that partly the issue of rail, PRASA have started their rehabilitation program, but of course as a team we need to bring back and bring in all role players because the trucks, the carbon emissions, all of those just damage roads and also our roads infrastructure. And Chair, I think the biggest problem that we have is that whilst your municipalities have the staff, that's road workers, that's construction workers, they do not have the equipment to repair the roads. So as part of our smart mobility campaign, where we have often run it once a week, we have expanded that to 3 times a week, with the road workers doing all their other work in between. When we go into a municipality, you find that they can support you, but it's the mayor, the MMC that would support the MEC. But you do not have that road workers with the equipment, and you say, as a province, we are now assisting you to fix the road. It's only province. And that is putting us way behind schedule when it comes to fixing of potholes. If you look at the portal app, you find that 85% of potholes has been fixed, but 95% of potholes remain unresolved in the municipality. And we as a department will have to then go in. But yeah, Chair, that's the response. Thanks.
Just before I take Honorable Ncube, maybe MEC also as an advice, you might want to employ Diana. You know, Diana, they say, can always give you hope, Diana. So maybe that members will have hope on what needs to be done. Honorable Ncube?
Thanks, Honorable Chairperson. Just a follow-up on the issues raised. The MEC mentioned the sewer and other things. But I think also the lessons we are learning from KZN, the July issue, the 2019, or 16 or 16, which has shown us that once we are not fixing the stormwater drainage, our roads will always be washed and affect a lot of things. So that also must be part of it's your direct responsibility on stormwater drainage. The other one, when the HOD was responding, he said, when someone dies, whoever was doing the job, or retire, you don't employ the same number, meaning replacing those that are retiring. However, you then rely on the external ones, which then say you opt for outsourcing. And there's a policy in a previous life, we call it Asifuni Kie, where one of the conditions of Kie was that, or IMF or World Bank, is that you keep a lean state and you outsource the non-core. So you cut on the personnel and then you outsource. Is that what is it influencing you of not employing people that are supposed to be doing that job? Because if you are employing them, you will be spending less in terms of their salaries. But when you go to the consultants or external, you pay more. So you are not saving. So what is the rationale of opting for the outside people than employing people that are qualified to do the job? Thank you.
MEC or HOD? I think the first one was just a suggestion. I think you can focus on the second one.
Yeah, let me hand over that question to the HOD. I'm also, let me hand over. Yeah. I'm of the same school of thought with Member Ncube.
Chair, we are not advocating for outsourcing the services that we could have done in-source, that we could have done in-house. No, we are not advocating for that. I'm explaining that in the past, you had a situation where people would leave and you would not replace that capacity, which resulted in over a period of time, that capacity has been eroded. We have started a process now, over the last 6 to 8 months, where the technical capacity needs to be brought back. We have advertised positions of about 140 road workers, 135 or 140 road workers, where we can pick them from the regions and allocate them there. So we have started that process, and that is to augment the current capacity that we have, but then also, as a result of the backlog, to address all the other challenges that we have on the roads. So no, Chair, I can clearly say that the road maintenance contractors is there to assist, but we have started to build that capacity in the department as well. Thank you, Chair.
Thank you, Honorable Atkinson. Then Honorable Ngube will ask question number 7.
Thanks very much, Chair. This question is about the underspending on the vote. So corrective measures have been put in place previously, but have not been effective in dealing with underspending. What other measures does the department have to augment the corrective measures that are already in place? And how does the department monitor the budget performance on a weekly and monthly basis? And how does a probity audit impact on community service delivery?
MEC?
Chair, with due respect and our apologies, can we request that honorable member repeat his question? Our apologies.
Okay, that's fine. These questions got to do with the underspending on the vote. So corrective measures have been put in place because there's been underspending previously, but they don't appear to be ineffective because there is still underspending. So what other measures does the department have to augment the corrective measures that are already in place? And then the second one is, how does the department monitor the budget performance on a weekly and monthly basis? And then how does the probity audit impact on community service delivery? And then does the department have a strategy on stakeholder engagements with communities? And then finally, what was the impact of flooding to the department, which resulted in documents being destroyed?
All these questions, MECs, are based on our interrogation with the responses you gave us previously, and these are just more follow-up questions. So over to you.
Thank you very much to the HOD and the CFO.
Thank you, Chair. Chair, yes, we must acknowledge that in the past we have underspent, even in the last financial year, we have underspent. I can say at this point in time, our underspending for Q2 was at 3% in comparison with, I think, 10 or 12% in the past. So Chair, the principal decision that I believe as the accounting officer that I've directed to the CFO and the team is, we need to monitor budgets on a monthly basis. By the time you get to the end of the quarter, it is actually too late if you look at 2 quarters to put intervention measures in place. Weekly reports needs to be issued to branch managers and the chief directors so that they can see where we are with spending of their particular areas in the vote. And on a monthly basis, the CFO tables a report. If the demand plans has not been fully realized for that particular month, the branches need to indicate to what extent will that be circumvented in the next month and prior to the end of the quarter so that measures can be put in place. I think from an operational perspective, that process is working well. The one area that would still be affected, Chair, is the issue of the compensation of employees. Not to the extent that it was in the past. We have just finalized the design of our organizational structure. And Treasury has been a bit pedantic this time when it comes to the concurrence, because you cannot submit to the Office of the Premier your organizational structure unless the Provincial Treasury provides you with concurrence that the budget is affordable over the MTAF. Treasury has asked us to recalculate. They've asked us to create some flexibility if there's a cost of living adjustment, which has been implemented now, that it would still be catered for in the current budget. So that has been done. The budget of 831 million, we have made sure that with everything as it is, that the new budget that we're going to cost will be about 824 million. So there is a bit of flexibility for that. So Chair, whilst there could be some underspending, it will not be to the extent in the past. We have rapidly started a process of filling vacant positions. As we sit, the department never had an executive management team, a full executive management team. As we sit here today, the full executive management team is appointed. The DDG Roads, the DDG Transport, the DDG Corporate Services, the CFO, and myself as the accounting officer, and you have the GFLI team that they will report on their measures that they are currently implementing. So that process, it's going to take a bit of time. With the amount of money that has been taken as a result of budget cuts, you would still find that the department sits with a vacancy rate of about 24, 25%. It means with the current post that you have on the proposed new organizational structure, all the old positions needs to be abolished. Because if you're going to have funding of less than 10% on your compensation budget, how do you fill 26% of vacancies? So all the positions will have to be abolished to make sure that you bring the available positions in line with the budget that you have available. But that's a continuous process, Chair. We hope to bring it in line by the end of March this year, because if you look at the AG's drivers of internal control, the part of HR was regarded as a concern. But with the new senior management team that has been appointed and all the other work, we believe that it's working well. Chair, the property auditors, to one extent, they're doing good work for us, but we have not put in proper timeframes for them. And that's the part that the CFO is dealing with. For instance, if we have finalized a tender, it goes through a property audited process. And that property auditors must confirm that all processes has been followed. They obviously go into a little bit deeper. But there's time when they are sitting with documentation for more than a month. And then the evaluation is done, it's just a process of the bid adjudication. So the property auditors serve as a valuable internal control measure, but we need to manage their timeframes. Chair, when it comes to the strategy to deal with community engagements, I think it's important to note that the result of the ongoing community protests is not as a result of the lack of stakeholder consultation, but as a result of proactive stakeholder consultation. My view is, by the time we get to the middle of December, Treasury would already give you a letter, what would be your allocation for next year, because APPs has been submitted, we tabled our reports to the Premier's Budget Council, we have made a case for certain allocations. So if we know we're going to have new roads or construction work in communities, the consultation process should start now, not after the 1st of April when we're starting to roll out a tender. So that is the proactiveness that I think that we need to deal with. And these are some of the additional measures that we are putting in place. Chair, of course, the bus subsidies has been a significant area of underperformance in our area. It is a legacy contract that has been extended all the time for about, I think it's over 20 years, if memory serves me correct. It's old contracts, it's outdated contracts. We incur irregular expenditure. At least Treasury has condoned the expenditure up until the end of the current financial year. We've gone out on tender as the Minister has granted approval. The Minister withdrew that concurrence. So what it means, we need to start in terms of the National Land Transport Act, negotiations with bus operators. The negotiation framework has been issued, engagement have started, the request for informations have been done. So we believe, Chair, we would still be having some underspending, but we believe that we're also on the right track. The only thing that you hope for now is if we can conclude all the negotiations and new contracts by the end of December, so that those that did not operate specific routes, that these people can now operate, we provide citizens with their services, and then we can pay for that. Otherwise, you're incurring under expenditure. I believe the other areas are not too critical, but the roads infrastructure part is also equally critical, which is Program 2, that deals with your roads infrastructure. Planning and design is something that we should look at, but the most significant problem that you're sitting with is a contractor provides you with all the guarantees to sign the contract. So much million in the bank, he can start the road, all the guarantees from the bank, everything. Contract starts, he starts working. We do not make advance payments. Once the first payment is made, of course, there is a program of activities that he needs to undertake. So some of these things he needs to fund before he gets paid. Poor performance of the contractors, going into liquidation, session agreements with other contractors, hampers delivery. And those are some of the things that hampers the Program 2 deliverables, Chair. Of course, I think we as a department can be a bit more efficient when it comes to dealing with tenders. We have proven in this year that we can do it, But we really, the poor contractor performance is something that we should look at. I was actually asking the legal team to investigate whether we as a department can implement further penalties on these contractors. Because we are working in terms of the general conditions of contract, which is standard. But if the contractor does not perform, what are some of the remedies? I think it needs to be a bit more stricter. Some of those are currently being investigated with the hope of expanding the nature of the work and how we deal with efficiency. Can the team, the DDG Corporate Services, on the issue of flooding, on the impact of particularly the AG audit, records management, how many has been lost, or the CFO, I think they can just add to that, Chair.
Yes, they can.
Thanks, HOD. Thanks, Chairperson. Yeah, we on that particular case of the flooding that occurred, I think some 2 years ago, the few records were affected, but we managed to reproduce those records. Fortunately, Chair, not all information on file was lost. You might have found that the file itself, the physical file, could have been wet from below. The top part of the files were still readable, so we managed to reconstruct. And fortunately, some of the documentation that might have flooded by that time, other similar record existed in the relevant branches. So we managed to do cross copies of those files, and we reconstructed some of those files. But I think HOD, it might also be of noting to alert the committee that the department is in the process of doing paperless EDRMS. So majority of our physical files are being scanned to reproduce them in electronic file system. And to that effect, we have appointed quite a number of cadets and interns to help us with that process, with the hope that we shall be able to deal with this possible flooding should they happen in future. Thanks, HOD.
Thank you very much. Any follow-up questions? Honorable Randall, then Honorable Atkinson.
Thank you, Chair. We also noted the comment made by the HOD earlier this year that the project management tool would assist in the management and reporting of project deliverables, and that would also assist in terms of your underspending. Can you maybe just, Chair, through you, maybe just allude to how successful this tool was? Thanks.
Honorable Atkinson.
Thanks very much, Chair. And I think my question might well have been mostly answered. But just with the last response that we had there, I think the gentleman from the department mentioned the fact that most of the files have been scanned. So can we draw a conclusion from that if there is another round of flooding, this won't happen again? So has that now all been resolved and everything is going to be digitized? And we don't only have files with information that can be lost. So if I just want to absolutely confirm the answer that we got there. Thanks.
Honorable MEC or HOD.
HOD, please respond to the committee.
Okay. Chair, thank you very much. Chair, yes, the project management tool serves as a useful basis, and it has improved management because we have now compelled our contractors to use the daily monitoring tool to report progress that they have made. Because remember, our project managers run from one side to the other, and you need to report on a regular basis how we are doing. And for this year, Chair, if we look at our reports that we have done on infrastructure to the portfolio committee, we have received 1 or 2 follow-up questions, as opposed to in the past, basically on every response that we have made, we receive follow-up questions. And this is primarily because we use the information that's on the system that we have verified to respond to any question from the portfolio committee or from the legislature. I don't think, Chair, it is at a level of maturity yet, but I can place about 75% reliance on the information that's on the tool to assist with how we need to move forward. The one thing that I want to encourage our officials on is to make sure that as we update, we also update the information and supporting documentation. That will assist us in having foolproof documentation by the time the AG comes. Chair, I think the DDG Corporate Services can respond to the question on the floods, but I can safely say, Chair, at the time that those floods happened, there was no digitalization. So the impact on, if there is a flood now, will be significantly minimized as a result of the documentations that has been scanned. But Chair, let's hope there won't be a flood in supply chain, because there's still a lot of information that we must still digitize. But thank you, Chair.
Thank you very much. Honorable Ngcuba.
Thank you, Honorable Chairperson.
Then we'll follow it by Honorable Dilang after that.
Thank you, Honorable Chairperson. With regards to the compliance with the legislation for annual financial statements, are there internal communication strategies to ensure the effective and timeous consultation and communication of key decision-making processes? Thank you.
Over to you, HOD or MEC.
Chair, I request that the team responds.
Chair, thank you very much. Chair, I think the issue of compliance with legislation, we have been significantly affected, firstly, on the areas of supply chain. And that's where most of your practice notes comes in on a regular basis from Treasury. I think recently with COVID and after COVID, there was various practice notes that came out. So of course we need to make sure that we fully comply. So the legislative framework in terms of supply chain is an onerous framework. And we believe that the major findings was on supply chain, not necessarily on all the other areas. But, Chair, the issue of the financial statements and how we account for that, the CFO can talk about that, but what we need to do is we need to ensure that we have our own reviews before we submit our financial statements to the AG for auditing. Of course, the Provincial Treasury do have that facility. I'm not so sure if that facility is as robust as it was in the past.
I think, HOD, the specific question was really about whether or you've got some effective consultation and communication plans or strategies on key decisions that are taken in the department.
Okay, sorry, I wanted to talk about the one part. Chair, the department has a fully structured governance model in the department where we have a senior executive management team where the MEC chairs that meeting. There is a senior executive management team that is chaired by the HOD. Then that includes your senior executives, that is your DDGs. There is an executive management committee that comprises of chief directors and DDGs, and then we cascade that down to directors as well as part of a broader management team. One thing that I think we should improve on a bit is how we communicate on a weekly basis. We have now implemented, and it was implemented in the past, a weekly communique on a Friday afternoon to staff on certain areas. The organizational structure was something that has created challenges. So I have communicated since my arrival on a weekly basis on the status of the organizational structure. And of course, some of the key decisions that we have made, some of the key activities that we have undertaken in the department, those are also then communicated. But Chair, there is obviously room for improvement. I think the one part that I believe is still a bit of lack in terms of communication is when those practice notes that's coming out from the Provincial Treasury or elsewhere, to interpret it, it will be easier for a supply chain management practitioner to implement it. But the business units must also ensure that they comply. So I believe that our work in terms of communicating that part in user-friendly language to ensure that they understand their basis for compliance is important. I don't think the compliance is a CFO's responsibility or a supply chain responsibility. It's an organizational responsibility because it's part of governance. So I believe that has been implemented, but there can be some work that needs to be done on that, Chair. Thanks.
Okay. Follow-up questions? None? Honorable Tilang?
Chair, thank you very much. MEC, HOD, CFO. The procurement and contract management. The committee has noted that information that is often required by the auditors, even in prior years, is not available or has gone missing. What is the corrective measures that are in place? I think we did touch on it, but if we could just readdress this, what is the corrective measures that are in place to ensure that the SCM officials do not delete crucial information again? Does the department have a cloud system to retrieve the information from, or is it just paperwork that's lying in the corner of a room? And what is the consequence management that has been taken against those officials who have been negligent and transgressed?
Thank you. Over to you, Ms.
Thank you. Over to the HOD and the team.
Chair, I'll respond to the one part of the question, and then the CFO can respond to the other parts. Chair, when we started the digitalization process, supply chain management was regarded as a significant risk. Hence, that process have commenced in that area. And the measures that I've explained earlier from the start of the tender, how we keep documents in a central repository, how we digitalize the documentation, and up until the award of the contract, to make sure that there's a contract that has been signed and all the necessary guarantees has been submitted. I believe that process that has been applied very inconsistently in the past are now applied to the fullest extent, and that's why you would not have any challenges in that regard. Chair, of course, we want to say that it is a system that is not fully matured yet. It's something that we regard as work in progress. Chair, all the documentation are kept on the system and it's filed electronically, so you should be in a position to easily retrieve the documentation. And to avoid the deleting of information or making sure that the information are discarded is that as soon as it's done, we make sure that it gets digitized. We hope that can reduce the risk of not having information available. Chair, when it comes to consequence management, there was two major findings in the past. The major findings was on the K46 contract and the bus subsidies. Those disciplinary hearings has been completed, and it is very senior staff members that was involved in this process. Some of them has left the department. The bus subsidies has been concluded. We have not issued the findings yet because we are waiting for the report from the presiding officer. There is currently a dispute between the presiding officer and the state attorney regarding payment. That particular presiding officer was appointed through the office of the premier, and the state attorney has appointed the presiding officer. So with the intervention of the office of the premier, I hope in the next month or so we can conclude that. So from those ones, consequence management has been implemented. There is other areas where consequence management has been implemented. We obviously look at the seniority of the people involved and then decide how to deal with it. I often believe, Chair, if you start taking disciplinary action, officials are looking at every means in the book to say the presiding officer is biased and just try to delay the process. So to appoint an external presiding officer that's independent, that don't know the case, he come and sit and listen, is often the best way. And that has helped that we conclude disciplinary hearings. I think, CFO, on the issue of procurement and contract management, whether you want to add anything on the additional measures that you and the supply chain management team have implemented?
Thank you very much. On the issue of the procurement contract management, we have really made significant progress. Excuse me, because we're happy with the milestones that we have achieved in terms of the processes, you know, to ensure that there's proper contract management, that there's documentation. However, we should not lose sight of the fact that we're also dealing with multi-year contracts where we have contracts that were awarded several years ago and they are still operational. And even in those cases, some of those contracts, it's where we will have issues where the AG will be looking for documents and they do not find them because those contracts were awarded several years. We are making efforts to try to make sure that where we have those contracts still operational, we actually find the documentation to the best of our ability, and I believe that we have made progress with regard to that. Going forward, I must indicate, as a department, we have identified that moving to e-tendering will actually help the department, because when you look at the volume of tenders that we receive and the amount of storage that you will require, it is really cumbersome. But unfortunately, because we are a government department and there are, you know, processes, authorizations, unfortunately, when we engaged eGov to say, can we go ahead with e-tendering, because we've seen in Gauteng it is working very well, and they said we were not allowed to proceed. So up until we actually are allowed to proceed with the e-tendering, or until eGov, for example, actually introduce, you know, the e-tendering system, especially considering the volumes of contracts that we receive as a department, in as much as we're doing our best to safeguard those documents, the issue of storage going forward will be a serious problem. For example, when you look at the maintenance contracts at the lower levels, like the RIFSA 3, you receive for one tender, you get about 3,000 tender documents, and that's hard copies that you actually have to find storage for. So those are the kind of challenges that we're looking at. You asked about the, you know, whether we have cloud. What we actually have all our documentation with regard to all our meetings, the reports, the probity reports, the bid adjudication reports, they all available electronically. So you will not have a situation where those kind of reports are not available. But we're also making sure going forward that, especially with regard to the tenders, the winning bidders, we are now safekeeping those in a safe. We've introduced the issue of making sure that those contracts are locked away, access is restricted, and we are happy with how that is working. Thank you.
Thank you. Any follow-up questions? Honorable. Yes, Honorable.
Thank you so much, Chairperson. The HOD earlier mentioned on the procurement contract management that the matter has been referred to the Office of the Premier in terms of the flooding and documents that was destroyed. Can we maybe just get an indication what is the progress been from the Office of the Premier's side? And then Chair also mentioned was made that some of the senior officials involved since left the department. In terms of consequence management, do you still track those officials? Do you know where they are? And if they would be found guilty, will there be consequence management even though they've left the department? Thank you.
Chair, I can say on the issue of the engagement with the OOP, that is ongoing. So we regularly have our engagement with them, forensic services, and all the other officials that deals with us. And they also report to the audit committee. That's part of the risk. Chair, when it comes to consequence management, when a person leaves the department and a person goes to another department, whether it is provincial, whether it is national, there is a specific section in the Public Service Act that allows you to write to the minister, the MEC on the other department, give the full charge sheet, and then implement consequence management. But you cannot force them to do that. We had cases in the past where we have written to a national minister and we have asked that consequence management is implemented. At times they would say, it's fine, I will support you. You appoint the presiding officer, you appoint the evidence leader, and you carry the cost, but it's fine. So there is times when you have full support. So you do have a situation where you can implement consequence management. Chair, in a case where the disciplinary hearing is underway.
How to say SCOPA? Okay.
No.
I withdraw.
No, you can go ahead. Go ahead.
It's a 1987 matter. And you look at the contract and the famous clause. It's a clause before the inception of the PFMA. And I think as a government and as a legislature, we have a leg to stand on. But when you check the historical background on this, is that, and one of the former HODs says, because I asked, did you fail in the court of law? He says, no, we never failed, but we never got to get to the court. And solely because the matter is complicated by another sphere of government, which is the national government in this regard. And I think, I don't know, maybe it's also unfair to us, you know, as this cohort of leadership to be dealing with this so much old issue. And I think, Chair, we will try. I'm told the matter is in negotiation, and the question is, what are we negotiating? It's like we don't have a way out, but I think given an opportunity as a department, we will be able to look into better ways of resolving this matter in the interest of the people of Gauteng and the people of South Africa in their majority. But as for now, it's unfair, and I think all of us must take responsibility, collective responsibility. We have failed the people of South Africa and Gauteng.
I can assure you, MEC, this is a matter even before this new leadership of SCOPA was there. From the legacy report we received, this has been a matter that SCOPA has consistently done oversight on. The oversight is, in fact, we ask why is, because the department that implements, not us. So we consistently ask, because the AG, when the AG raises the matter, we follow up, we ask one reasons, we know that based on that, promises are made by yourselves. Next time we meet, nothing has happened. Last time, because of our questions, we got to understand that this matter has now been, the tender has been advertised, and now then there was a problem. You see, so we're doing oversight. So there was a problem, which is not SCOPA's problem, it's a problem of the department, the national department. So yes, we do exercise oversight on this matter, which I want to assure you. And we will continue asking you even next time when we meet. Honorable Tau.
Thanks, Chair. I'm not getting into the policy issues. I do have views on the matter. But isn't this a competition issue also? I mean, isn't it that, in fact, we've been dealing with it as a litigation matter? And sometimes I forget I'm doing oversight. Isn't it that government deals with these matters as a litigation matter as opposed to a competition issue? Because, I mean, an evergreen contract on its own is irregular in the current regime. And I'm sure between the Commission and the Tribunal, there could be some matter that should be engaged. And I mean, from a previous life, and you can imagine how long that previous life was, this matter had been on the agenda between the municipalities and the province. And the argument was always that the department in the province is actually slacking in terms of addressing these matters and finalizing on this issue. But I'm just asking whether, shouldn't you be looking at an alternative angle of dealing with this issue? On the policy side, I guess it's a completely different debate around the design of the ITP what your bias is in terms of subsidy and so on. But that's not for SCOPA necessarily. Thanks.
You see, Honorable Tau is doing exactly what we've been doing all the time. We make suggestions to you, you come back and say, no, it doesn't work. So I want to say, so we're going to make this recommendation also as part of our report. We want to hear what you're going to say. So you don't have to respond now, because we're going to make it as a recommendation to the House so that you can see how it works. But if you think you want to respond now, you can. But I can assure you, we'll make it as a recommendation.
No, Chele, are bambisaning, it's an old issue. I think you'll agree. It's unfair to my age cohort, and unfortunately, we're the ones who should be dealing with it. And what I can appeal to the honorable members is, mas bambisane until we arrive. I know you'll say you are doing oversight, but look, the recommendations have been there before. And I think from the side of the department, the recent was to address the competitiveness of the contract. But you read through the contract, there's that clause of the first right of refusal. I even investigated when was it put as compared to when did we adopt the PFMA as a government. And you can see there's something we can do, but the question is, why have we not moved an inch as a government? But I'm saying it's all not lost. I think masipambisana sizonqoba. I don't know how, but yeah, we will. It's true, it's a monopoly issue which needs all of us to work together and resolve it.
Honorable Ngobe.
Thanks, Honorable Chairperson. Whilst I can agree that PADCO has been monopolizing when one was very, very young, and we were seeing public utility transport cooperation, what is PADCO? Then when we were still young. However, honorable members, whilst we are doing about monopoly, I want to make an example with PADCO. There are other buses that have been subsidized. Let us also look, we've been crying about integrated transport and the poor public transport management in South Africa. So let's say this case wins. What do we put in place? Because we'll also be robbing those that are depending on these buses. Just now we have problems of trains. The rails have been stolen, it's been open now. We don't know what's going to be happening next week. For instance, there's Greyhound that pulled out last year, if not beginning of the year, and that was subsidized by the state. But nothing that was put in place when it withdrew. There is no longer a long distance. So there is now a gap in terms of, in the place of Greyhound, the long distance people that they are using. Then they go to the taxis, which you know how they speed and accidents. So as we think about this, what will government put in place in order to ensure that people are not disadvantaged in terms of integrated transport and also access to transport? Thank you.
Let's do this, honorable members. The suggestions we're making so that they can carry more weight. Let's make them in our report to be adopted by the House. I can tell what's going to happen. We can make suggestions here. Sometimes it's difficult to monitor if they are going to be implemented. But I think the MEC is listening. She's expecting those recommendations so they can be investigated properly and a proper report is brought to us. Can we agree on that? Okay, thank you very much. MEC, we have come to the end of the oversight on the roads and transport. We had to take some time because there was regression there. we're worried really that this department has regressed. So that's why we had to take some time. I'm not sure if the presentation of on G-Fleet is ready, and who's going to do it from your side, MEC? They can fly it there.
Thank you very much, Chair. The presentation was submitted for circulation to honorable members. It's ready, and the team is ready to make a presentation if the portfolio committee allows.
We had agreed that it must be presented, and I'm hoping that Simon and the team are ready to flight it, because I had said that that will be presented by yourselves. Okay, if they are not ready, do you mind we take 5 minutes break, then we come back? On MEC, wait, before that, MEC?
Just on a point of before, Chair, may I request that I be excused? I have a political engagement with the NGO that has deployed me. I'm risking being reshuffled by continuing post 4 o'clock, because I said the meeting is going to finish at 4. With due respect to honorable members, I request that the team present in my absence, if members allows.
You've asked the wrong question at the wrong time. Yeah, honorable members, what's your view? The MEC is asking to be excused, and then she will remain with the team to deal with the issues of G-Fleet. She says, if the members allow. What's your view, honorable members? Are you okay with that, honorable?
Chair, can I just ask the time allocation for roads and transport? Was it from when to when this afternoon? How much time did we give them? Maybe we're running over that time in any case.
It was up to 5. What the invitation said?
1600.
Okay.
I
think.
Member.
Oh, sorry. I think what Honorable Randall is saying is that if that was the case, then we have no choice but to excuse you. But we want to emphasize the following, MEC, that our problem is if we engage officials, most of the time what we discovered, there are things that you agree upon here. Later, some MECs dispute those things because they're not in the meeting, and it becomes a problem. That's why we prefer to engage MECs, because it's MECs that account to the legislature, it's not officials. So that's the main. So we will for today excuse you, and then we'll take that presentation. I think it will not take more than 30 minutes, but let's take a 5 minutes break now. MEC, you're excused. Thank you very much for being part of this meeting, and thank you for honoring it and ensuring that you commit yourself that next time when we meet, I think that's what you said, next time when we meet, things will be better. Thank you very much.
Thank you very much, Honorable Chair, and thanks to honorable members.
Let's take a 5 minutes break whilst they are putting up the presentation. May I have your attention? But the department isn't here, so. May somebody please get the department to come and make the presentation? Okay, let's please close that door behind you so that we can continue with our meeting. Over to you, CFO. I'm told that you're the one who's going to make the presentation. Over to you.
Good afternoon, committee members. I've prepared the presentation in terms of the responses to the questions that have been posed to the entity.
If you can bring the mic closer because I can't hear you. Yes, thank you.
Am I more audible now, Chairperson? Thank you. The purpose of the presentation, Chairperson, as I alluded earlier, is to provide the responses that have been posed to the entity for the audit that was concluded in July 2022. The first issue that has been raised and question raised by the committee was for the entity to provide the committee with details of the entity having high number of vacancies in the finance unit, resulting in the incorrect accounting treatment of prepaid maintenance. Chairperson, if I may be allowed, just to bring the committee in the same page as we are. The structure that we have been operating as GFleet was last approved in 2012. And the last time we had a director within the finance unit was also in 2017, and so is the director, deputy director ASD post. It was last occupied in 2017. So we are confirming that in terms of the root cause that have been identified by the AG, and where there was an expectation that we correct the accounting issues around the prepaid maintenance. The team could only correct the accounting issues pertaining to the prepaid maintenance for one financial year, which was the 2020 to 2021 years, 21 financial year, and we could not go further than that because of the timing issue at which the finding was raised, and also in terms of the capacity. So what we have done, Chairperson, is that we have appointed a service provider that's working with us in ensuring that we do verify the vehicles, and we also go through the records to ensure that we split the maintenance cost and not capitalize everything within the entity. We have finished the first stage of the exercise, and we have pulled about 5,000 documents that we're busy analyzing at this point in time. And we will do then the split as required in terms of GRAP. And by end of January, we would have what we will call the preliminary figures, and we will then continue to work on what we have, so that by the time the financial year end comes, we would have dealt with this particular issue. Question 1.2 as well relates to the vacancy rate, Chairperson, which I've already spoken to, and I am hoping that the committee would allow me not to repeat what I had said earlier in terms of what's happening within the finance unit, and also in terms of the entity where we were sitting at the 30% vacancy rate, which is higher than the DPSA norm. So we are feeling, we had advertised about 31 posts last December, and we're in the process of concluding the appointments. I think 23 interviews have already taken place, and the last lot of officials that would be recommended for appointment will then assume, will be appointed towards end of December and starting in January, Chairperson. The next question is about physically verifying all vehicles owned by the trading entity. I have alluded to the fact that we have about 4 officials within the asset management unit, and those officials are managing 6,500 vehicles, and most of the vehicles are not necessarily residing in our yard. We have clients that are also in other provinces that are utilizing our vehicles, and there were vehicles that could not necessarily be identified or brought to the AG for verification, and that led us to that particular findings of not being able to verify all 6,500 vehicles that were in our books. And we've done the corrective measures, and I've alluded to the fact that we've appointed a service provider that has started working on the effective 17th of October 2022. They've already verified all the vehicles that we had up until end of October, Chairperson, and what they are busy with now is analyzing that information. And after the analysis, then they will assist us in terms of how we account for the vehicles, and also with the split of the maintenance cost, and also with the depreciation issues. And after that, as we move closer to the end of the financial year, then they would also be assisting us with collating the information and verifying the vehicles before we can submit our annual financial statements. The next question, Chairperson, or request was for the entity to provide the committee with details for the entity having high number of vacancies in the finance unit, resulting in the occurrence of the formula errors in the asset register as it is in Excel. The same response, Chairperson, is provided by the entity insofar as the vacancy issues and the progress made in ensuring that we reduce the vacancy rate and ensure that the unit is capacitated, both using our internal resources and also the external resources, where we have outsourced, but the outsourced company is working with our internal team to ensure that come end of the financial year, we can account for the assets of the entity. And the next question is around the inability to deal with the depreciation and accumulated depreciation for the vehicles that are owned by the entity and not classified as finance lease. Chairperson, here the issue emanates from two areas. One is the fact that we overstated the cost of the vehicles due to the incorrect capitalization of the costs associated with the purchases of services and maintenance plan, which is an issue or the area that I spoke to earlier on. Because whatever depreciation we made on our vehicles not having split, it affected the total, depreciation that we disclosed in our annual financial statements, which was incorrect because of that inability to split the capital cost and the maintenance plan. And the second issue comes from GRAP 17, where there would be delays in licensing the vehicles and also the timing issue in terms of when the depreciation needs to start. And that's one of the areas that we were found wanting by the Auditor General, and we are resolving that particular concern. And I have mentioned that we have appointed a team of relevant people that will be assisting us in correcting those prior year financials and also deal with the depreciation and also reconstruct the asset register of the entity, which will then enable us to ensure that we calculate our asset our depreciation and accumulated depreciation correctly. At this point in time, Chairperson, because the entity is in the process of developing its own integrated fleet management system, and we are doing that exercise through the e-government, and it's a multi-year project, and we will, because we've appointed additional staff, we are hoping that the errors will be minimized because there will be segregation of duties and people will be able to do the reconciliations and the checks and the verification processes and have those signed off before we submit our annual financial statement. The next question is, or request is to provide the committee with details of the entity's audit improvement plan that was not effective, resulting in errors in the financial statement. Chairperson, I think here I just need to pause and just indicate that for the findings for the 2021 audit are different from the findings for the 2021-2022 audit. The audit improvement plan that we designed for the 2021 financial year were designed to deal with the findings that were centered around what we called work in progress within the structure of the asset management, where the Auditor General found that we did not impair or made provisions for impairment of the 3 buildings that we were rehabilitating as an entity. And also, we did not necessarily classify the vehicles that were earmarked for auction but not yet auctioned correctly in terms of GRAP. So those issues that were raised and which were the basis of the audit outcome for the 2020-21 financial year, those were resolved when we implemented our audit improvement plan, because we went out and we then used an engineering company to assist us to deal with the work in progress findings on the 3 buildings that we were rehabilitating, and those particular issues then were presented to the AG and were resolved. And also in terms of the classification of the vehicles that were earmarked for auction but not yet auctioned, that issue also was resolved. Now, for the audit that is now being under review now. The issue is now on the property, plant and equipment in terms of our inability to split the maintenance cost from the capital cost around the depreciation issues and also the fact that there were vehicles that they could not necessarily verify. So for the 2021, we had implemented most of the issues that were relating to that were the basis of the qualified audit outcome, save for the areas that we're still implementing in terms of filling the posts, the key vacant posts. That process we're trying to ensure that it will be concluded by the end of December 2022. So that's the clarity that I wanted to bring forward to the committee, to say the audit improvement for the previous audit was implemented to the extent that we were able to address the issues that were the basis of the audit, qualified audit, but then the issues that came in this new audit are slightly different from those, and our new audit plan currently is now addressing those particular issues, and we're also looking at other possible high-risk areas that might lead to a qualification, and we are working with all the stakeholders that can assist us in ensuring that we do not regress and get a qualification. We have been provided a resource by Treasury as well that's working with us in the asset management unit. And the CFO, who has been seconded from the department for the previous financial year, we received an extension that he can continue to serve GFleet whilst the structure of the entity is being reviewed. And we're also trying to create additional posts over and above the current post establishment, so that we provide for the CFO post and the other critical posts that we do not have in the structure. When it comes to the performance, annual performance issues that were raised by the AG chairperson and members of the committee, the main issue in the previous financial year were issues around the township, how we classified the townships, and whether the AG could test whether the businesses that were awarded tenders below 500,000 then were businesses from the townships. And the other issues, two issues in terms of the annual performance report emanated from the two KPIs on maintenance, from which we were dealing with West Bank, and the two KPIs on maintenance, we did not take them through into this new financial year that was audited by the AG. And for the townships, we received a spreadsheet from the Department of Economic Development, which is the department responsible for managing the township economy. But when the Auditor General was auditing that particular spreadsheet, they could not still be happy with the townships, because the definition of townships is broader, and they thought that the definition was not smart, and that is why we were penalized as an entity, and DED at the point of audit could not necessarily assist us to verify that particular list of townships that we had awarded tenders. 4.41, Chairperson, on annual financial statements. Sorry, I think I skipped. In terms of trying to resolve, Chairperson, the issue of the township economy revitalization KPI, we had then approached Department of Economic Development once more, just to get their assistance and also in resolving the audit query. And we then agreed with GDED and Office of the Premier and Treasury that because the work that they are doing in establishing the supplier database of the township enterprises zone within the province is not yet finalized, it will be prudent for the entity to drop that KPI in this financial year, but still maintain and award the townships the business that we we were going to award them, but report on the actual achievement in our narrative report. Because once they finalize that supplier database of the township enterprise, that database will be used by all the provincial departments. Question number 4 was based on annual financial statements, and the entity was requested to provide the committee with details for the lack of proper record keeping for evidence and supporting documents for financial statements. And this, as a background, chairperson and members, we tried to give the context in terms of where the finding comes from. It's not necessarily that the information was not there, but the information in terms of the timing of the information and the lack of the capacity that we had, we could not necessarily pull all 5,000 transactions where we had purchased vehicles with the maintenance plan as an entity, and that's why we had that particular finding. We have already done that verification with the service provider that has been appointed, and we approached all the OEMs, and they've also confirmed what we claim to have purchased with the maintenance plan, and that's what the service provider that has been appointed is currently analyzing, and we will then distinguish between what we will call finance lease items within our PPE and also report accordingly in terms of the GRAP. And 4.2, the entity was requested to provide the committee with details for the non-effective implementation and monitoring of action plans that were developed to address audit findings of the prior year, resulting in the occurrence of the inadequate internal controls on financial and expenditure management. I've spoken extensively to this particular issue where we said we have implemented the majority of the action plans that we develop in our audit improvement plan, save the action plans that were pertaining to organizational structure and also filling the key vacant posts in the entity, which meant that new areas were identified and picked by AGSA, which then meant that we then received the qualification for the entity. The next issue is that the management is expected to set up an appropriate tone to ensure that all staff comply with established policies and procedures as well as applicable accounting standards, and the audit action plans should be actively driven by management to ensure achievement of the milestones. Chairperson, I must report that on this one, this is one of the recommendations that we take seriously as we fill the vacant posts, especially at senior management level. We will then be in a position to drive the processes. If the committee had seen our annual report, they would have noted that the entity had about 8 senior posts in the post establishment, of which 3 were filled by the end of March 2022. And at this point in time, in terms of the current drive to fill the posts, we have filled 6 out of 8. So there is improvement in terms of the vacancy rate at senior management, and all the senior managers in terms of their performance contract, they have this KPI as one of the KPIs that are also monitored on a regular basis. And the audit improvement plan we do present on a monthly basis to the management committees and also to the audit committee in terms of the rate of implementation of the action plans. 5.1, the entity was requested to provide the committee with detail of lack of consequence management for poor performance and transgressions, as well as the detail for the slow response from investigation unit at the Department of Roads and Transport. Chairperson, The current structure of GFleet does not provide for that function as the entity is regarded as a branch of the Department of Roads and Transport. So all our investigation requirements are then forwarded to DRT, and DRT, using their internal staff, they will then start the investigation. But unfortunately, the reports coming from DRT the entity did not receive the reports on time to ensure that we implement whatever recommendations that will flow from the findings of the investigation. We have then had a discussion with the DRT Anti-Fraud and Corruption Unit, and they have allocated all our cases to a new investigator who's now at the point of ensuring that the cases are investigated, and all the cases for GFleet will then be concluded before end of January 2023, so that we have the 2 months to ensure that we implement the recommendations thereof. The entity was then requested to provide summary of any investigations conducted and concluded by a public protector in the financial year under review. There were no investigations, Chairperson, that were conducted by a public protector for the entity. So 6.2 will not necessarily be applicable, and the summary of investigations conducted by the public protector for 2022-23 financial year, and we're also saying there are no investigations there, Chairperson. And we were then requested to provide the summary of any investigations conducted and concluded by forensic unit in the Office of the Premier in the financial year under review 2021-22. Chairperson, we have given a summary in terms of the investigations that were done by OOP. There was a lapse in terms of handing over the report to GFleet for implementation of the recommendation, and that report was only handed off. It's a 2017 report. It was only given to GFleet, Office of the CEO, in the previous financial year, and the case now where there is disciplinary processes that are being implemented. That case is supposed to sit on the 30th of November, which is tomorrow, and that's the essence of the case that was concluded by the Office of the Premier for the misuse of the state vehicles by one of our officials. And the next slide also linked to the similar case. We had an internal official that is refusing to testify against the official that is being charged for the misuse of the vehicle, and that the Labor Relations Office is assisting us in ensuring that the cases are concluded. As I mentioned, that the case is sitting tomorrow, Chairperson, and we will then get the report from the presiding officer in terms of the way forward. I've summarized this case. The date was initially set for 23rd to 24. It has been moved to the 24th to the 30th of November, Chairperson. In terms of the investigations conducted by the Office of the Premier in the current financial year, there are no investigations, Chairperson, that were conducted by the Office of the Premier. In terms of the list of investigations conducted by the department or in the entity in the 2021-22 financial year, we have provided the list of the investigation. The entity is yet to receive the reports from the Anti-Fraud and Corruption. We have been promised that the reports will then be submitted to the entity by end of January, Chairperson. That brings me to the end of my presentation, Chairperson.
Thank you very much. I'm trying to find out from members if there are either questions or comments as well are also allowed. Let me hand over to you, honorable members, but I want to also ask that our colleagues or our colleagues here from the municipalities, if you also have questions or comments, this is the opportunity to do so. Let me see if there are any hands. Honorable Randall, Honorable Ngube, Honorable Tau, then Honorable Kanyan.
Thank you so much, Chair, and thank you for the presentation. I just wanted to ask, because I'm not very familiar with GFleet, is there tracking devices in these vehicles to track them in terms of, being stolen, diverting from routes that they're supposed to use? Chairperson, also other departments, what system is in place? Is it, I think it's community safety, other departments that's making use of the pool of vehicles, and how do you track that? I noted the Excel spreadsheet that you're still using, and I think the sooner we can get it digitized, the better. I think it would make control and management of your fleet much easier, Chair. And then, in terms of damages to your vehicles, is there a contract for the repairs, or how does it work when one of the GFleet vehicles are damaged in an accident? Where do you take them, or is there a panel that would then decide where this vehicle goes, and what's the average turnaround time from it being sent to the repairs and receive it back so that it's operational again? Thank you, Chair.
Let me ask you to respond to those so that you don't lose track, because it's several questions. Just respond to them, then we'll move to the next one.
Thank you, Chairperson. In terms of the tracking devices, Chairperson and members, we do have tracking devices installed in all our vehicles, save for the departments that will request to be excluded from the process because of security-related issues. But we do grant them that permission, but then transfer the risk back to that particular entity should that happen. So we can track the movement of the vehicles, also the behavior of the drivers, and we can give exception reports in terms of how that is, insofar as that is concerned. In terms of the system that is being used by other departments like community safety is one of our clients that we're currently servicing. So what they would do, they would request that the entity procures the vehicle on their behalf, and we will give them a quote in terms of what they will be paying us on a monthly basis, and then we will provide them with those pool vehicles, which they would normally use them for over a period of about 3 years or 4 years. And then they will bring back those vehicles back to the entity for replacement, and we will auction those particular vehicles. So, but then in terms of how they manage the pool vehicles, they're guided by what we call the handbook, which is a national handbook which guides government departments on how the vehicles ought to be utilized and how they ought to account for the utilization of the vehicles thereof, from approval up to also ensuring that they pay for the fines when they transgress all the road traffic acts and so forth. Chairperson, in terms of the need for us to move away from the Excel spreadsheet, I think we're on the same page in terms of that. That is why we are moving towards the integrated fleet management system. It's a system that's supposed to have been designed a long time ago, but there were delays. I think at some point the entity went out into the market and tried to get a tender for that, and that did not necessarily work. We then mandated our provincial treasurer to do what we called a market research, and the recommendations from that market research exercise that was done by treasury was that it's better for the entity because of the complexity in terms of the operations that we're running as an entity to develop its own integrated fleet management system. We also tried to explore the possibility of using the Western Cape system, but the Western Cape system was sitting on an Oracle-based system, and the province is currently not using Oracle at this point in time. So that is why then we resorted in developing our own system using eGov, and eGov will then be assisted by developers that they are now acquiring externally because of the complexity of the project, and also fleet specialists because we do not want to develop a system that's not going to work for us going forward. Hence, we're trying to get as many expertise as possible in ensuring that we will have an efficient system and which will then assist even the clients to do the request for vehicles whilst they're sitting in their offices, and they can just come and pick them up, and we can account for our vehicles all the time. In terms of the damages, how do we deal with the damages if our vehicles are involved either in an accident or there are mechanical failures and so forth? We are participating in a transversal contract which was awarded by National Treasury. It's called RT46 contracts. It has various categories, and one of the categories is what we call managed maintenance. Managed maintenance would mean that FNB or West Bank, which is the appointed service provider for that particular category, would have various merchants across the country that they would appoint and contract, and we will then take our vehicles to those merchants, and we will pay West Bank. West Bank will pay the merchants accordingly, based on the work that they would have allocated. The issue of the turnaround times on the repairs and mechanical repairs, that's an area that we're still having challenges at this point in time, because one of the key decisions that we made as fleet manager is that vehicles should not be taken to any merchant who is not within the space where you are. It's a 50-kilometer radius kind of a determination, and some of the merchants, you would find that in the areas where vehicles are involved in an accident, you do not have the requisite skills, and they have to also move. And also from the West Bank side, and some of the merchants, even though they would have gone through the processes of verification when they were taken on board by West Bank, you would find that they do not necessarily have those skills at some point in time. And sometimes there will be a need for them to extend the time for repairs, because when they strip and coat, they might not pick up everything that needs to be fixed. It's something that we're still working together with West Bank and FNB in terms of trying to shorten that turnaround time on repairs and mechanical repairs. It is sitting, we do not have what you would call a formal report coming from the West Bank system at this point in time, because it's still under development. But when we look at our books from my officials and reports from our external clients, it can sit between the 20 to 25-day period in terms of that, and we're trying to reduce that to an acceptable level. Thank you, Chairperson.
Okay, thank you. Honorable Ncube.
Thanks, Honorable Chairperson. My clarity will be, there's something that talks about the cars that are utilized in other provinces. And then in response to that, then you got the service provider to verify. And then on the unaccounted cars, it's also the verification service provider. And my question will be, does it then mean that there are no strategies to mitigate these problems? And from long, same challenges in terms of the chief fleet has been raised for several years. But let me also go back to the vacancy rate. The HOD talked about the vacancy rate, you die with your post. You retire with your post, then instead, then they don't, you don't appoint, then you go for external people with outsourcing. And even here, when cars disappear, then you go to service provider. Are there no people employed that are responsible to monitor and verify these cars? You also talk of the lack of capacity. So as you identify the problem of lack of capacity, are there strategies that are put in place in order to address these gaps that are pulling down this entity? If we have then high rate of vacancy rate, what stops the entity or the department not to appoint? Is it going back to the question of lean state, but going outside and pay more? Or there's double, I don't know whether I say double dipping, not double dipping, but a service provider or a consultant employed to do this whilst there's a person inside that is doing the same thing but not doing the right job. So your intervention strategies, have you put them in place and they're not working? And then you resort to the external services. The question of the unaccounted cars, because I didn't see anything in terms of what has been done for that. And then if something has been done, was those things in terms of getting them or finding out what happened with them, also going back to the service provider to track them? Thank you.
Okay, I assume Honorable Ncube, where you were referring to department, you wanted to say the entity, or you're really referring to the department?
I'm assuming that GFLIT is an entity of the department.
Yes, but, so you are referring to the entity. What I'm saying, if you say the department didn't do this, are you therefore, you mean the entity didn't do it because it's managed a bit differently from...
Okay, let me say the entity part.
Okay, thank you. So that when she responds, she knows what she's responding to. Okay, over to you. You can respond.
Thank you, Chairperson. Let's start with the cars utilized in other provinces and maybe take the committee backwards in terms of trying to understand how come we manage vehicles in other provinces. We have about 49 client departments in our books at this point in time, and 16 of those are provincial departments, and the rest are national departments that have presence in various provinces. So that's why you would find that there would be GFLIT vehicles in the various provinces. And we do not necessarily service the provincial departments in the other provinces unless there's a need for that. For instance, where they would need vehicles for MECs and mayors, they would open an account with us, and then we will provide those vehicles accordingly. Now, coming to the issue of whether the entity is using external service providers for work that would be done by internal people, I think, Chairperson, I would want to take the committee back. I've mentioned earlier on that the last time the structure of the entity was approved, it was 2012. And the entity has evolved and it has grown. And the demand for our vehicles is much more. And yet the posts within the entity have remained stagnant from 2012 to date. Now, you have about 4 people in the current structure that was approved in 2012 that are managing a fleet of 6,500 vehicles that are located everywhere. And given that you have to resolve the audit finding from AG within a limited space of time, then the only option that we have is that we appoint a service provider that is going to work with the 4 officials in ensuring that they verify their vehicles. They also assist with the split and also assist with the reconstruction of our asset register and also deal with the depreciation issues. You would know that we're not using the general accounting principles that are used by other departments. So our accounting policies and principles that are applied within the entity are much more similar to that of the private sector. So we're using GRAP standards, and GRAP standards are not necessarily the easiest standards that you can implement in a government department, which is also constrained resource-wise and also technology-wise. It does not necessarily have the best technology to assist with some of the functions that could be done efficiently over electronical systems. So we do want to ensure that the structure that is being developed by the entity now talks to the strategic thinking and visioning of the entity, and hence we now as an entity reviewing the form and the shape of the entity. If we remain as a trading entity going forward, we will not necessarily be afforded an opportunity to have a CFO, because if you're a trading entity in the government sector, all the corporate functions are supposed to be performed by the mother department. So that has crippled us as an entity, and there is recognition for that. And we are submitting, we have submitted a business case to Treasury, which they are also supporting, so that we can move to what you would call a government component, and we can have the functions of the CFO, we can have a fully fledged risk management team, which will also deal with the anti-fraud and corruption issues. We can have our strategic planning and monitoring unit, and we can also have other key functions that we currently do not have in our structure. So that's the strategy we're trying to put in place to ensure that in terms of as we grow as an entity and as our strategy also evolves, we have a structure to support that. And we do not want to rely on consultants. If the committee also looks at our history in terms of how we've been utilizing consultants, you would find that over the past few years, we have not necessarily relying on consultants. The last time we had consultants, I think it was around 2015-16 financial year, and we have been carrying our operations with the limited staff that we had as an entity. So why have we not necessarily filled the post in the past? Chairperson, there was a moratorium. A moratorium, if it's decided by the department that you cannot fill the post, it affects the trading entity. And we also started then to fill the post or advertise for the post after the moratorium was uplifted, and hence we could advertise the 31 posts that I spoke to earlier on. So, but when we become a government component, we'll be free of what the mother department decides, even though other policies would, most of the policies that pertains to HR will still be applicable. But the decision-making in terms of how the structure is managed and the posts and how the posts are filled, those will be decided on by the head of the government component in consultation with the MEC and any governance structure that the MEC would want to put in place. I think I will pause there, Chairperson.
Thank you, Honorable Tau.
Thanks, Chair. And my starting point is to note that this is a regression, so it means that this, and there could be one of 2 reasons, at least in my mind, why you have a regression. The first would be that you had the controls and systems in place, and that the controls are beginning to have challenges, and you have a variety of reasons that you can provide for that. It seems to me that the reason is, well, we don't have the staff, but we have the controls. but the evidence suggests otherwise. And I'll get back to that point. Because if we say the regression is as a result of staffing and capacity, we would need to demonstrate that. And I think it's an important point to demonstrate. But if the average staffing size has not changed year on year in relation to the previous years, then the worry would be that in fact our controls or your controls necessarily have limitations. And it's something in the control environment that needs attention. And I would want you to comment on that. Alternatively, it could be that these are areas that the AG has historically not audited. Therefore, we might not have identified these gaps in our systems, or whatever the reason is, but it's not something that has to do with controls, and that necessitates a different set of actions. So I thought I would preface my questions with those comments, also hoping that you would be able to reflect on the comments. Excuse me. Now, there are specific issues and areas that necessarily should raise some light bulbs. And I won't go into all of them, so I've only selected two. The one says that at the depot you have manual systems of control, of controlling entry and exit. Therefore, you can't verify the vehicles, or the verification team can't verify the assets because the systems are manual. Now, I mean, you can imagine in a system where you can't account for vehicles because they are outside the depot, and you say, well, actually the vehicles are outside the depot, I don't have a system of verifying them. Now, even in a manual system, you would be able to go and say, this is the driver, this is the person that took the car out at this time, and tick a box. It's a bit more tedious, but it's possible to tick the box. Unless, in fact, the manual system does not keep the necessary records, because then it means anybody can come in and out, take a car, and it's not accounted for, which should be an issue of concern in terms of the controls at the Bedford View plant, was it depot. So that very statement at least worries me to the extent that it suggests significant limitations in the control environment, which takes me back, excuse me, to the original point that I'd raised about controls, because to me it suggests a fundamental flaw in controls, and therefore a propensity to lose assets. I mean, if you can't keep track of the asset, then you can simply lose it. And all you can say is actually nobody kept adequate record about movement in and out of the cars, at least for the team that goes to verify. A second issue relates to the reporting issues. So your response says no. Part of the problem is that there were issues in the formulae that was applied in the accounting for certain assets. So it's an accounting and reporting issue. And that the biggest issue is about capacity, which brings me back to the question, but historically, how have you dealt with it? It necessarily is a key risk to have the same person that signs off an invoice to be the same person that authorizes it. There's a problem already. You authorizing your own transaction. On its own, it's a control issue. It's not primarily an accounting issue. For me, it suggests limitations in the control environment. Because if you don't have the checks and balances, then your system is prone to one error, two manipulation, and at worst, malfeasance. So the response that suggests that it's a capacity issue means that we're dealing with staffing as only a capacity issue, not as a risk management issue in areas where you have significant risk which has to do with verification of transactions, so to say. So in relation to the responses, I find that there is a bias towards suggesting that it's a staffing issue, when in fact it suggests significant limitations in the control environment and needs to be dealt with as a risk in the control environment. In the first instance, it's not an HE response issue. Of course, the HE will come and deal with the issue because that's their job, but it's a primary risk management issue in the entity. Thanks.
Maybe in the interest of time, let me also take okay, sure. I thought I was going to take the comments or question from Honorable Kanyani. I was checking with our colleagues from MPEX if there's any comment or question. Okay, you can respond. Over to you.
Thank you, Chairperson, and I'm not sure whether I should start with the last commentary. In terms, and I agree with you fully in terms of your analysis in terms of the staffing issue being dealt with as a risk issue. If the committee had our strategic risk register, you would note that one of the key risks that we have highlighted centers around the loss of assets and inability to account and all these things, and our mitigating strategies would center around having a fully capacitated unit and so forth. I have mentioned and agreed that the high vacancy rate within the finance unit compromise the work that needs to be done there, because you will have someone doing something, but you might not necessarily have a verifier or an approver at the same time, because you will probably be using the same person. Case in point, you would have an acting director finance who's also responsible for his post or her post, which was the deputy director or assistant director, whatever. So already there you already compromise the controls, because there is no one on top of that assistant or deputy director that can verify and sign off, which is why when we were recruiting, we started with this, what you will call control posts, so that we can deal with the segregation of duties issue and ensure that those risks are mitigated. And the controls are not necessarily compromised. The issue of the light bulbs, as you've termed it, the light bulbs have been there, but it's not necessarily that we do not have systems within the entity. It's not all manual systems that we're using. We have what we called an old fleet information system that is being used, and which have not necessarily been modified and aligned to the SOPs as we improve our SOPs internally. So that system, I'm told it was developed in and around 70s and is being utilized. I think the last time we had the service provider that developed that system coming in to assist with some of the controls that were needed. I think that exercise was done in and around 2017 financial year. And we are using that for all our long-term lease contracts, which would be the contracts for all the vehicles that are taken by the various clients for a period of a year or 3 years. You will find the contracts there, and you will find everything. And in terms of the short-term lease contracts, you also have a system, which is also the FIS that we're using, and there will be certain transactions that are down outside the system, but then the information has to be then captured into the system, and that is where sometimes we find challenges as an entity because of the lack of the capacity, because there will be a time lag, and they will have backlogs from time to time within the various units, especially the VIP and pool unit that has many transactions because of the nature of work that they're doing. So the the issue in terms of ensuring how we deal with those light bulbs, I think towards the end of the financial year, we would do what we would call a reasonableness test to check whether all our vehicles are in the system and whether all our vehicles are billing and are they billing correctly in terms of the tariff that has been approved by Treasury, and that's what we do. It's outside the system. It's not something that we would say is the best mechanism, but because we want to minimize the number of findings on our revenue and also around the availability of assets, we do use that reasonability test as an entity. But going forward, once we get that integrated fleet information system, we will then be doing everything within the system. There are alternative audit mechanisms that are being used as well in terms of using the information from the tracking devices that we have installed. There are shortcomings as well in terms of that, because sometimes the officials would know I'm trying to phrase my statement correctly. They would know the tracking devices where they are, or even get their friends from outside and try to remove all the tags. But we do have what we call exception reports that we manage and monitor closely, so that tags that are not necessarily functional are replaced immediately, and even the tags that we use for starting the vehicles, if the officials decide not to use them, then we do ensure that we have them fixed immediately, so that when we have to use that tracking report as an alternative mean of verifying our vehicles, we can always tap on that report as a reliable source of income, of verifying our information. The issue, Chairperson, that have been raised as well in terms of the observation from the member is that there are some areas that were either not audited by the AG, which have now come to surface, and also either our controls are weak and the systems are not necessarily there. Let me start with historical issues that have not been audited. I have mentioned, for instance, in terms of the entity starting to procure vehicles with maintenance plan. That practice started in 2017, April 2017. So between 2017 and 2022 April, 2022, before the last audit, that practice has been there, and the AG has never audited and raised any findings to the entity to say you ought to have split, the maintenance cost from the cost of acquiring the vehicles that you disclose in your asset register. So it was a completely new finding for the entity, and we had thought that it's an acceptable practice in terms of how we've been accounting in the past for that, until someone within the AG, I think, knew GRAP better than most of us, and then started to question that. So you will find instances where AG has never questioned, and then they will say, because they've started auditing those particular areas, and then you'll have those kind of findings. The same case, same point in terms of WIP, and also how we've been accounting for vehicles that would be identified for auctioning and not necessarily auctioned towards the end of the financial year. We never had a problem with AG until in the previous audit as well. So there will be areas where they themselves improve in terms of what they want to audit, and entities will not necessarily be ready for that because they've been disclosing things in a particular way, and there's never been findings or even a query on those particular issues. I spoke about the controls in the system and the capacity issue. They go hand in hand. You can design the best systems and best controls, but if you cannot necessarily ensure that there's adequate segregation of duties, you already running at a risk of not having your controls implemented 100% as an entity. So we are trying to ensure that we attract the relevant skills and people that can, that would know what needs to be done at whatever point in time. Also, what we have done in the entity is ensuring that the SOPs of the different units within the entity talks to one another. Because what we found out at the handover level from one unit to another, because you have a unit that deals with the procurement of the vehicles and everything, and you'll have another unit that then deals with the leasing, and when their vehicles needs to go for repairs and go into the workshop, there might be some control weaknesses that are identified there. So we've looked at what we called integrated SOPs and also tried to close the gaps in terms of that. And that project, we are hoping that the integrated SOPs or revised SOPs will then be approved by end of January. That will then ensure that we deal with the controls. And important to the SOPs is that we need to workshop and ensure our officials know the SOPs to the T. And it's not just a document that's going to sit on file and only presented to the AG when it comes, when they come to audit. So we have factored that in our audit improvement plan, so that we're going to have regular sessions with the various staff that are responsible for all the processes and the systems that we deal with. I'll pause there, Chairperson.
Thank you very much. Let me take this opportunity to first thank the MEC in her absentia. I think I did earlier when she was leaving. And the HOD and the team for appearing before SCOPA and for providing us with the necessary responses. Obviously, if there are other matters we'd like to follow up, we'll do so in writing. So I would like to release you now. But I also want to take this opportunity to thank Gauteng Treasury for being part of this process and assisting us. So I would like to also release you. But our colleagues from MPEX, can they remain a little, because there's a matter I want to deal with. So thank you very much. You are released. May I ask that the recording of these public hearings, it has come to the end. This is now on social media. So if we can stop that recording, because what we are going to be discussing now is just internal. I'll appreciate